So, Pepsi. So test results, stations. I will say new things today. So things that you have not heard before and are very important for people who are going for the exam. Okay? This branch I will discuss test results. What is the station about? It will be about a patient who is coming to you with his results, which means that he had test results like bloods, swab, yeah, biopsy, and today you called him to discuss with him his results. So why do I say minimum 2 stations in this branch? There is something that we need to know. In UK, and listen carefully, any blood result station, will be in a GP clinic. What do you mean any blood result follow-up will be in a GP clinic? What do you mean? I mean that most stations where the patient is coming and the question said discuss the test result with him or with her, it will be a GP setting. Why? Because you only follow up in GP. You don't go to the A&E and they take blood from you and they say to you a week later, come for follow-up and they will tell you about your result. No. It's always GP setting or specialist setting. I'm following up with the urologist. Yeah? Specialist. But it will never be a hospital A&E setting or anything. So, why do you say these things? Because it will be all of them cold cases. What do you mean by cold cases? Cases that's not urgent. For me to take blood from you and say come a week later for the follow-up of the test result, and then the station said to you the patient is coming in for follow-up of his result, for you to send him home, and a week later is coming so you can tell him the result, that means it's not urgent. However, maybe you found something in the blood that yes, you refer him for something. Okay. These are some principles. Now, which is new to you guys, these things are new to you now. If I have a station that is test result, if I have a station, and remember this word, you must have minimum 2, where you will discuss the results with the patient. That's a new structure. I will say now, and please refresh it. If you have a station where it's test results, if I do this scenario with you now before the session, I will notice, and you will all notice, that we do not give space to explaining the result. What do you mean? You must spend your time on explaining the result. Most of us don't. Really? Yes. 2 minutes, 3 minutes, it's fine. But you must take your time in explaining the 1/3. 1/3, yes, of the station is explaining the result slowly and the patient understanding about his results. Okay. We are a bit lost. Before I discuss the stations, I want to give you the structure. If I have any station where there is test results there, which structure should I follow? Okay? The structure that I will follow, 3 parts. 3 parts. And please remember this structure, because you will have to use it. I think I focused enough. You will have to use this, you will have in the exam. The first part is history taking. History? Yes. Is it the history of P1, P2, P3 maftosa? No. So, 3 parts. The first part is history. What about the second part? Which equals the first part in amount of marks. Explaining the result. Really? Yes. So explaining the results as important as taking history, which we neglect. I know you guys, I know that we think what's missing. We neglect explaining the result. We always think that we need to ask questions about the result quick, yeah? You have anemia and your blood hemoglobin is low and that's it. No. Take your time in breaking down the results. Okay. What about the third part? Is what? Management. So management. Guys, history, explaining the result and
management.
Think about it. As if explaining the results is like diagnosis. As if this is the diagnosis. You understand?
Yeah.
So, how much history?
Focused.
Guys, just the history that this test confirm.
Okay.
Really? Yes. So, for example, a very common station. A patient is coming for follow-up of blood results. His hemoglobin is low and the MCV is low. MCHC is low, like microcytic hypochromic anemia. Hemoglobin is low. Discuss with him the results. Station is clear, important. What is the history I will take? P2, no. History will be symptoms.
Anemia.
Symptoms of what?
Anemia.
Of anemia. Yeah? Only symptoms. Differentials, no? Just symptoms. Causes of what?
Risk
Anemia.
factors,
Of anemia, which is in brackets, risk factors,
complications.
and the complications. Complications of what?
Anemia.
Guys, so the history is only the symptoms, the causes, risk factors, and the complications. What about differentials? I mean, I will ask this patient what brought you. He will say, because I was tired. Should I ask causes? A, B, C, D, E, F, causes of tiredness? No. So the history will be focused only on anemia. Only about the symptoms of anemia, the causes of anemia, the complications of.
Anemia.
Okay. What about explaining the results? Guys, as much time as you will take in history, please take in explaining the results. So, explain in details. Okay. Give us example. Give us example of the second part. What do you mean explain in details? For example, if the station is follow-up of blood result, thyroid function is low. Thyroid function is very common station. They tell you a patient is coming to the clinic to follow up his blood result, and they give you TSH
High.
is high,
LH.
T3, T4 is low. Talk to him, and this is concerned. Now, I'm telling you how to explain the
Details.
result. What do you mean details? What do you mean take your time? Take your time that I will say to him. We have a gland in front of our neck that is called thyroid gland. All right, doctor. In your case, this thyroid gland is hypoactive, which means that it's the hormones that this gland secretes is decreased. Oh, really? The hormones not enough? Yes. These hormones that this gland secretes called
T3.
T3 and T4. Don't say to him what is T3 and T4. Okay. Do you know what is the importance of this gland? No, doctor. These hormones are responsible for the body function. Oh, really? Yes. So, for these hormones to be low in your blood, that means that your body function is slowing down. That's why you are feeling these symptoms like tiredness,
Constipation.
increase in the weight gain, like feeling cold when everybody is feeling. You understand? So you see how I explained it,
Yeah.
which we don't do. Well, from the information you told me, yeah, the test here T3 and T4 high. Would you like me to tell you how would we manage you? Literally, that's how we do it. No. Take your time. Thank you very much. Yes. Thank you very much. Take your time in explaining the. Take your time. Yes. 2 minutes, it's fine. 2 minutes. But the time, no. Don't worry. You don't need P2, P3 مفتوزة. So don't worry, the time is okay. So, now I'm sure by now you know about my time management in these cases. My time
Manage.
history, how much? Just
2 minutes.
symptoms, causes, complication. That's it. Of whichever these test results saying. Okay, what about the result? Take your time. Very important. Then management is managing the condition that we're talking about, okay? Can you give us another example? Okay. Hundreds of stations test result. For example, a patient is coming, and this is black question. She presented and swab was taken and shows gonorrhea. Shows what? Talk to her, address her concerns. People ask Desa, maftoz. No. History, explaining result management, yeah? In history, what do you want? The swab shows gonorrhea. So what do you want? What brought you for this test? What brought you for? For this result. In order to get that. But what is the question to get the symptoms? The question is, what
What did you have in the first place?
brought you from the first place to have this result? She will tell you, I had 1, 2, 3, 4, which are the symptoms. Okay? Then the risk factors, you know, it is gonorrhea. You don't need to. No. Only sexual history. Only sexual toys. Only partner. Only and one thing. Only one thing. You see, I should have said 1, 2, 3, but only and then the only. It's not only now. So sexual history in details. In details, yeah. Sexual history. Sexual toys, yes, and partner. Are you following me, guys? And have you been tested before for STI? Yes. Then complications. Oh, what is the complication of STI?
BID.
PID. You understand? So you can ask here any long-term pain, any pain during sex, any pain while passing urine. You understand me? So Dr. Musso, only this history. What about this diet, exercise? What about any medical condition? I don't care. What will the medical condition affect your station, which is sexual history station? What about smoking? No. Smoking and this stuff, if the case said she had discharge or she's having discharge, yes, you can take your history. But the station said biopsy is taken, showed melanoma. Swab is taken, showed what else do you want? Gonorrhea. Swab is taken and it is gonorrhea. But Dr. Mo, why do we need to take history then? Why do we need to take history about the symptoms and the causes? Because simply when you manage any concerns, yes, doctor, why did I have it? Why did I have this thing? Then you have asked about the causes. Yeah, you had it, love, because multiple partners and unprotected sex. Yes, you had this because of this. Yes, you had iron deficiency anemia because you are bleeding, because you have heavy period. Because. So the risk factor, the reason why I ask about the cause is because the patient will ask me, why? And unless you know the reason, you're not going to be able to talk. Guys, is it clear? Structure in your head. Do you know now what is, how much history is it? Because I'm going to start, and every station will take from me 3 minutes. Clear? So, this is the structure, but we will all have beautiful approach. The approach is confirm my identity. I'm Dr. Faisal Bab, one of General Doctors here. Can I please confirm your full name and date of birth? Okay? He's yawning, but he kept it. I can see it in his face that he's yawning.
Too much cloud.
His facial muscles. Yeah. So, what is the approach? Any test result station, this is the approach. Can I please confirm your full name and date of birth? All right. I can see from my notes that you are coming for follow-up of your test results. Thanks for coming to see us today. She's coming for a follow-up. Thanks for coming to see us today. So, would you like us to discuss the test result first Or is it okay if we have a chat in order to be able to explain the results in a better way? Well, doctor, we can have a chat, it's fine. Then you will start by history, then explaining,
Results.
then management. No, doctor, please tell me the result.
So we start with the result.
So start with explaining that,
Results.
then take,
The history.
then management. So you can swap history and explaining the results can change. If she said to you, no, I need the result, doctor, please tell me the result. Okay, it's fine. Then start by explaining the
Results.
results. And after you finish the results, tell her. So is it alright if we have a chat in order to get to the bottom of this and why is it happening? Yes, doctor. Then start with your history. Are you confused?
No.
Are you lost? Please. The approach is confirm identity. After confirming identity, right away, don't say how can I help you, please. Don't say how can I help you. She's coming, you should be
Aware.
expecting her. I can see from my note that are coming for
Test
That's right.
test result, swab result, biopsy result, whichever there. Would you like me to explain to you the result first, or is it okay if we have a chat in order to get to the bottom of things? Yes, doctor. You can have a chat. Then you're gonna start by taking
History.
history. And in history, the first question, what brought you for these tests from the first place? Then the patient will give you the symptoms. Then you'll ask them about the
Risk factor.
causes. Then you'll ask about the complication. That's it. So now I would like to explain the result for you. Then explain the result. Would you like me to tell you how would we manage it? Then start about management. Clear.
Yes.
What if the patient said to me, no, I want the result first. Okay? Then explain the
Result.
result. And after explaining the result, you need to take the history. So, is it alright now if we take some history, or is it okay if we have a chat to explain things in a better way? Yes, doctor. Then start taking history, and the first question in history is,
Why?
what brought you for this test? Or why did you come for this test? Clear, guys?
Is it necessary to give the options that I should would you like
Yes.
to know the
Yes,
test
yes,
results
yes,
or
yes,
can I
yes. Yes, it is. You are coming. Why are you coming?
For the
have
results.
Test results.
What's your main concern?
Results.
So, but my main concern is
To have a chat.
history.
Yeah.
So I'll give you the option. Do you want your main concern or do you want my main concern? No, my main concern. But be careful because in the mock, because you guys read and you know the scenario and you read it few times, it happens a lot. Is it okay if we have a chat, or would you like me to explain to the result? Explain the result. But we can have a chat first. Wallahi. No. I need the result. But we'll have the chat quick. Guys, I need the result once. Explain the result. So be flexible. After explaining the result, then go back to,
It's the history.
and please, in history, no data, no maftosa, no medical conditions, nothing. صحيح.
Still, we don't need to ask the allergy if we give
In
the
history,
management-
nothing.
In the management, if we give any medications,
Sorry?
in the management, if we give any medications, we don't need to know the allergy history.
Guys, that's something else. When I'm talking to her then about medication, I can say to her, it's fine. Are you allergic to anything? It's fine. It's okay. But I'm not going to go deeply into
Details of Maftoum.
the history of like this travel history. No. My history is literally what I'm talking about now. But you can simply, I will give you this tablet. Have you taken it before? For example, any allergy to anything? It's fine. But my point is, it's not the history that we are used to, which we all take. And even in these cases, yes. So from now on, we have a structure for any station that has results. Please, one thing you don't start by how can I help you? Because that will make the patient, you should be expecting me. I'm coming for you to discuss with me my,
History.
not how can I help you? How do you mean? That means that you don't know anything about my condition. No. Follow up, you must start by, I can see from my note that you are coming for follow up. I spend about 20 minutes in the structure because that's the core. The rest is quick. Yes, boss.
Some stations will be the results like breaking bad news, like ductal carcinoma inside, for example. It will be like cancer results. So,
Yes.
And she's worried. She's very worried. No, doctor, I'm worried. I want
Yes.
the results now. I want the results now.
Tell her the result.
Okay. Then this now is it's like she's now breaking emotions.
Yes, yes. Tell her the result.
What should we do?
It's fine. Tell her the result if it's her main concern.
Okay.
And when she breaks, when she's like, leave her, give her space. Then
Back to the history.
back to the history and the management. 100%. If the patient, the main concern is why, I wanna know, I need the result. No, guys, BLAF 2 is depending on patient, the main concern. End of story, yeah? So now I will discuss the stations, but literally, as I told you, we're gonna do 20 stations, maybe. Every station is 3 minutes. And in these 3 minutes, I will tell you, what will you say in the 3 minutes? I will tell you what is the history, relevant, and I will tell you explaining the condition and management. Clear. And management, I can even say further management. Why further management?
We already started.
Because we already started management by
The investigation.
doing investigations and stuff. So what will you do now? Clear? So I can tell you to recap every station. That's what I'm going to do now. I will recap every station in 5-6 words. Really? Yes. So these 20 stations, every station should take from us 4 lines. 4, and that's it. That's what we need to remember, and go with the structure, and go with the patient, go with the flow. Okay? So the first station, you are an FY2 doctor in the GP clinic. Mr. Adam Wilson, 30 years old. One of the things that we improved in the new course, no Alicia and no Alex. That's it, Adam Wilson, and you know. So 30 years old, presented a week ago with lymphadenopathy. Very common station, yeah? Lymphadenopathy, all right? Tests were done and confirmed HIV. And you can even make it 2 weeks ago, 2 weeks back. He presented with swellings. HIV was tested positive in 2 occasions. A week apart, each occasion. Talk to him, address his concerns. Clear? Okay. Is the station HIV?
No.
Anybody? This is station. Is it HIV?
Yes.
I mean, what I mean, it is confirmed. Test result.
Yes.
Test results confirmed.
Confirmed.
Do you wanna diagnose?
No.
Are you looking for your diagnosis?
No.
It is diagnosed. So my point is, so we only taking the approach is again the approach. Hi, I'm Dr. Fatah Al-Bab, representing Dr. Zahir. Can you please confirm your full name and date of birth? I can see from my note that you are coming for follow-up today of your results. Yes, doctor. Thanks for coming to us today. Follow-up. Thanks. You know, because he's coming for follow-up. You might not have come, yeah? So, is it okay if we have a chat first? Or would you like me to explain the results? Doctor, do what you want. Then start by taking what is that? How many questions in history? How many points?
3 points.
What brought you for this result, for this test from the first place? Then causes of HIV. Causes of what? Causes of what?
HIV.
HIV only. You don't need to look for anything else. And complications. This is my history. So, what brought you from the first place? Doctor, I had swellings, lumps, whatever. So explore it. That's it. Explore the complaint, which is the symptoms. Then causes. What are the causes of HIV? The risk factors for HIV. The risk factors, anything to do with bloods.
Traveling.
So remember one word, blood. Blood. So sexual history,
Transfusions.
IV drug abuse. Make the sexual history and the IV drug abuse together because they both something nice. Drugs. People know? Yeah, I'm joking, yeah? Just a joke. Sexual and the IV. Don't put something in between. Don't say sexual history, then blood transfusion, then no. Sexual and the IV drug abuse, they will come together. What else? Previous surgeries,
Blood transfusion.
Tattoos.
tattoo,
Piercing.
tattoo and piercing, yeah, travel history.
Traveling.
That's it. This is the station. When I ask what will happen, the patient will give you some risk factors. Some risk factors. Then I will go to explaining the results. But because you're explaining a bad results, when I mean bad result, I mean not anemia, it is HIV. So try to basically break it down. Do you have any idea what's happening, Mr. Andrew? I'm now giving him the result, yeah? The result is HIV. Is it something nice? You have HIV, you know? Is it like this? No. Do you have any idea what's happening? I'm trying to read his
Mind.
because if he said, yes, doctor, I'm thinking it's HIV.
Why do you think? Explore.
You can say why, or you can say, I'm afraid it is. Doctor, like this, no steps, no. He actually helped you, and he's telling you, don't break the bad news. So if I ask the patient, guys, I'm talking about explaining the result. I hope you are not lost. So when I explain the result, because it's HIV, it's a bad result. So I will start by, do you have any idea what's happening here? If he said, no, doctor, no. Well, I'm sorry, we have some bad news here, and then explain the result. But if you tell him, do you have any idea what's happening? Yes, doctor, I think I'm having HIV. Don't say to him, don't elongate it. Some people, because they are scripted, they think that they will do the warning shot. Wallahi, I will do the warning shot. Your brother, he told you, I'm suspecting HIV, and it is HIV. So I'm afraid it is the case. Right away. You don't need to break the bad news. He knows. He's expecting it. Clear?
Like his word was the warning shot.
That's sorry.
His word is the warning shot.
He knows. He said to you.
Can we ask him that? Do you know what the test was?
You know what the
Do
test?
you know what were you tested for?
You can. Yes. Yeah. It's the same as the having nowadays. It is the same. So my point is, if he's mentally ready, if he gives you, like in Breaking Bad News, for example, I'm not gonna discuss Breaking Bad News now, but if the patient said, "Doctor, is my dad gonna die?" and you know he's gonna die, don't say, "No, he's not gonna die. Wait, I'm just gonna use the 2 more shots and then I will tell you." And then after 2 shots, yes, he's gonna die. No. If she tells, "Is he gonna die?" and it is written he's gonna die, so unfortunately, don't be scared. It's written he's gonna die, and she still, is he gonna die? People still ask warning shots even if the patient is ready.
Okay.
No, if you feel the patient is ready, that's it. Okay. Anyway, so explain the result, and then I will come to management and managing this case, HIV. You're gonna talk about the partner, safe sex, yeah? And the patient, you will tell him, it's only a tablet a day. Okay? Deal with it as a medical condition, as diabetes, as blood pressure. And even with diabetes and blood pressure, sometimes patients, they have to take more than one. But this is only 1 tablet. Doctor, is that the right way to tell him? Is it that simple? Nowadays, yes. Is that how we're gonna talk? Because HIV, you know, back home in Egypt, you know, this الحب في طابة, this Egyptian film, people, you know, they cannot use the towels and they are depressed. It's an Egyptian film. You know this film? It's an Egyptian called الحب في طابة, Love in Taba, a city in Egypt. Yeah, they brought HIV back 15 years ago as these guys are, you know. But now, please, when you talk to the patient, can I reassure the patient?
Yes.
Is it kind of reassurance here, or is it false reassurance?
No.
Reassure the patient.
Especially if not complicated.
Yes, reassure the patient, and yes, it is a tablet a day, and yes, this patient will have a normal life, will lead a life, you know, and he will start practicing safe sex, and they will lead a normal life. Do you understand me? With 1 tablet a day, things will be controlled. The CD4 count will be controlled. Yes, reassure the patient. So let's start the session quickly, yeah? I will just recap it from the notes, yeah? But you know now the point, yeah? That's it. Hi, how can I help you? No, follow up. Not hi, how can I help you, yeah? So, I can see from my note are coming for test result. Yes, doctor. Would you like me to explain it first, or
Have a chat.
have a chat? Chat, doctor. So the chat, what brought you for this test from the first place? Doctor, I had some lumps. Explore, where is the lumps? How many lumps? Is it only in the groin or anywhere else? Under armpits, in the neck? Lumps.
Okay.
Is it painful? Apart from the lumps, anything else? Yes, doctor, I felt a bit tired. Doctor, I had some diarrhea. Symptoms. Then, right away, I will go for causes. Well, should I ask sexual history right away? I know it's a risk factor. Signpost it. Sometimes Mr. Andrew, sometimes Mr. Alex, whatever, when we have patients with such presentations, we tend to ask them some questions that is relevant to these cases. Would that be all right? It can be intrusive sometimes. Yes, doctor, it's fine. Sexual history in details or just one question? In details. Are you sexually active? Do you practice safe sex? Do you have a stable partner? Okay? And
Does your partner have the same sex?
you can even ask here if you're suspecting HIV
Gender.
about the gender preference as well. You want to know in details because it's more engaged, right?
Yes.
So you want to know in details, okay? I'm gonna say something, you're gonna be laughing, you're gonna think I'm just trying to make a joke. It's not, because we all, our background in Egypt and Pakistan and India, our background is different. People sometimes they mix sexual position with sexual preference. I get asked in the mock, what positions do you have? But I know that they don't mean the position, they mean preference. So be careful, okay? Because it's not related to position. And people do ask it, thinking the one I know, he wants to ask about the sexual preference, but he end up by asking sexual, thinking, this is the question. It's not. And then the simulator will start laughing, and then it will be just, mess in the station, yeah? So preference, okay? Under pressure, we say it. Anyway, so I start asking sexual history in details, ask about any past surgical history, ask about
Travel history.
IV drug abuse. So I'm sorry to ask, do you take any drugs? And then explore. Ask about travel history. Have you traveled anywhere recently outside UK? Okay. And ask about the partner. When you ask about the partner, does the partner have any symptoms? And that's it. My history is finished, guys. Then I will explain to you the result now. Then when you explain the result, do you have an idea what's happening? Sorry? We don't have what?
Complication.
Yeah, complication in these cases, all like,
Fever and diarrhea.
yes, all like related to what he comes with. Sometimes weight loss, sometimes diarrhea. So it's there anyway. These patients sometimes they come with a complication.
Maybe we can ask occupation if he's working.
Occupation, because you want to know if he's a doctor. He will need, to know, because if he's a surgeon. Yes, yeah. So anything to do blood. That's, as I said, blood. Anything to do blood, yeah? Then I will explain the result. Please break bad news. Do you have what's happening? Then explain the result in details. Then management. What is the management in these cases? HIV.
Antiretroviral
Management.
medication.
Infection refer to special.
What if the patient, if I'm explaining the result and I said HIV and the patient said, doctor, what is it exactly? How would you explain HIV?
It's a viral infection.
Viral infection, yeah?
Transmitted through
Okay, whatever he told you, sex,
Yeah.
blood,
Blood.
okay, and it affects the
Immune
immune system.
Defense system.
So the patient's immunity is usually
decreased.
decreased.
There is an
Clear? Now, I'm giving you his concerns, his questions he will ask in this station, yeah? Doctor, am I having AIDS?
No.
No, don't say no, say AIDS is late stage. Yeah? Am I having AIDS? Another concern. Doctor, am I going to die?
No. Hopefully not.
So I'm really sorry about what you're feeling, because that's like for him, with the treatment. Can I reassure him?
Yes.
Yeah, with the treatment. HIV now is like any other medical condition. Sometimes patients are diabetic or they have high blood pressure and they even take more than one tablet, but this is with one tablet, everything will be controlled, okay?
So it is a
Now-
treatable condition.
Sorry?
It is a treatable condition.
Yes.
I will tell him in the
You will
diagnosis.
control, not treatable,
Yeah.
control.
Controllable.
Okay, yeah. So now, when I manage, I said management, is it counseling or new presentation? Counseling.
Counseling.
So arms all the time, arms. Arms is the management in counseling.
Yes.
Arms. So guys, arms fit good, yeah? Any case like this, arms. Advice, so you will advise him about the cause. And about sex, yeah? Protected sex, yeah? And you will advise him about telling his wife or his partner. That's A. A is advice. R, risk factor. You will talk to them about the risk factors, the causes of HIV. Like in your case, it's caused because of this, because of that, because of that. And here you can advise them about sharing blood. Can he transfuse blood?
No.
No. So advise about anything to do with blood. Clear. It's a blood. Yes?
In case of multiple partners.
What? Protected sex, guys.
Yeah, if he had multiple
The lab
sexual
pass.
partners previously.
Yes.
We will require
Contact tracing.
tell him that we need to notify all of them.
You need to notify
All of
Yeah.
this.
the partners,
You have
yes.
to tell him like you need to contact all of your
You
previous.
tell him
Contact tracing.
this condition, okay, is transmitted through sex. So we highly advise, we will want you to tell your partners to come and get tested. What do you mean how? You mean if you had sex with like 100 partner? That's now thinking beyond
His
the,
case.
yeah, you understand? So risk factor, please, sharing needles, avoid the blood transfusion.
If he says no, and I offer a partner notification program, and he says no, okay.
Give him some time to think. Okay, we can give you some time to think, but obviously you ask why,
Oh,
and you tell the risks of this
I
being
mean,
transmitted.
in the end,
You have
are
to.
we going to tell
You
him?
have to, yes. HIV, yes. HIV, you tell people at risk, okay? Okay? So investigations, so ARMS, AR, MMS, M is for medication and investigation. So please, investigation, don't forget to check for further STIs. You know, to get screening for all types of STIs, yeah? Clear?
Yes.
Yes. Because he can have other STIs, yeah? Even though that we will check for HIV,
We check that.
we will check for other STIs, but I will still, okay? Mention it. Now, the medication, I said, 1 tablet, okay? And the safety rating, what do you think safety rating is?
Safe sex.
Safety rating, how would you say
And
the
the
patient?
and the complications.
Safe sex, yeah? Safe sex. Make sure you have condoms all the time,
Comply
okay?
with his medicine.
Sorry?
We should just do tell him
Compliance about medicine.
And modify the risk
Okay.
factors.
So, any risk factor you found, talk about it to avoid it. Next station. Armed emergency anemia. By the way, I take longer in the first stations, but then we'll go quick, yeah? But it's the first station. Second station, you are an enforced doctor in the GB clinic. David, 60 years old, presented 3 weeks ago. 3 weeks? Yeah. With what? Tiredness. His blood test shows hemoglobin low, 105, MCV low, 78, white blood cells, platelet, everything else is normal. Liver function, kidney function, normal. So the problem is hemoglobin and MCV is
no.
low. Okay. Listen carefully, and the station can end here. Then you will you will discuss the station as iron deficiency,
Anemia.
but you will say further iron studies. Clear. Ferritin level and stuff, clear?
Okay.
But some stations, they give you the iron studies. Am I making sense?
Yes.
And this station, they give you iron studies, okay? The ferritin is low. The iron is low. Talk to him, and this is concern. Guys, since, do you know what is the station about?
Yes.
Iron deficiency anemia. Anybody has it out?
No.
That's it.
If they didn't give you the iron levels and the iron,
I will still deal with that as iron deficiency anemia, but make sure you, in the management, further iron studies.
Because it can be thalassemia if the iron is
Yes. Yes, but I'm saying even make sure, but with thalassemia, when I take from him some history from here, family and stuff, you know. So thalassemia is coming. So in this case, same approach. Do you want history, or do you want not like this, as I said, yeah? Or should we discuss the result? Doctor, you can do what you want. What brought you for this test from the first place? He will say, doctor, because I was feeling tired and heart racing, lightheadedness, explore. Then you know it is anemia. Do you know it's anemia?
Yes.
Do you know?
Yes.
So now the causes. The causes. What can cause anemia?
Blood loss.
Either I am not eating. Guys always start like in the chronological order. Either I am not eating well. No. I am eating, but malabsorb. No. I am eating, and there is no malabsorption, but there is blood
Loss.
That's it. That's what I'm gonna ask about. How is your diet? Right away. How is your diet? Dr. Mo, they will think I'm scripted. They will think I know the state. Some people do so. they will think I know the station from before. Yeah, ma, we know the station. It's anemia. You understand? It is anemia. You understand? Really? Yeah, it is anemia. You know, like some station, a female abdominal pain, ultrasound is done, and it's ectopic. And when you say like, yeah, talk about it, they tell you it is ectopic. So this station, yeah, is diagnosed. So the causes. Diet. How is your diet? What is the second question in the causes? I hope you are not lost, yeah? Right away. Malabsorption. How to ask about malabsorption?
So I'm going to ask him after eating, are you feeling that there is bloating or difficulty?
Okay, bloating, tummy pain, what else?
Stool difficult to flush. Stool difficult to flush.
Yes, and difficult to flush. So I always tell, think of the question, how you say to the patient. Don't think of it as a medical term.
Yes.
Because yeah, it's malabsorption, but I don't want to tell you, how would you ask it? Then you might think about it. So always think of,
How to ask it.
not the complaint, ask how would you
Ask about it.
ask it, yeah? So when you think of meningitis, don't say, oh, meningitis as differential, meningitis or space occupying lesion. No. Think, how would you ask for meningitis? Any fever,
Rash, next
any rash, you know? So
vomiting, diarrhea.
causes. So we said number 2 is malabsorption. What is the third cause?
Blood
Bleeding.
loss.
Blood loss. So I would say to him,
Are you bleeding from
do you think that you're bleeding from anywhere with your body? Your mouth, your nose?
If female asks
What about your stool?
Color.
The color of the stool?
Female.
And you can ask if it's a female about period. Clear? Done. If you want to be safe and ask about complications, dizziness.
You can ask about
Blood
alcohol
thinner.
Because
only.
it could be
Blood thinner.
Only
severe.
alcohol in this station.
Sorry?
Ask about alcohol only in this station.
What do you mean alcohol only? Because of what?
Higher than alcohol.
Yeah, what do you mean alcohol only?
Yeah, nothing else in this. Only
Guys, that's it. Nothing else. Nothing else. The station is saying it is anemia. Please. خلاص. Anyway, then explaining the result. What does that mean? What does that mean? People eat it. 20 seconds. When we've done some result, everything is normal apart of the hemoglobin is low, the MCV is low, and the iron is low. Okay? Should we tell you how we do manage you? No. Take your time. That's it. You all know what is hemoglobin. You all know how to say that we've done iron studies as well to check for the amount of iron or the level of iron in your blood, and it's quite low as well. Also, there is something called the MCV, which is the volume of the blood cell. That shows again that your blood cell is
No,
small. And the dye in your blood, the dye. What is the meaning of the dye? Guys, the MCHC. You don't say, and the MCHC mean corpuscular. No. Tell him as I said, what is MCHC? Hypochromic. What is
You say
it?
it's a weak blood.
Sorry, no, but
Weak blood.
weak blood, that's too much. That's like he has done discount on the result. Weak blood. That's now it's a discount. 50% off of the result. I will tell you, weak blood. That's too. No, I said take your. Explain to him what is iron deficiency anemia. Guys, am I making sense?
Yes.
Wallahi, it is important in test result. It is called test result. He needs to know what are these tests and why. And so explain to him the hemoglobin is low, the volume of the cell is low, the hypochromic, which is the cell is low, and the size is low, the size is small, and the iron studies. Clear? You see how much I've spoken about every single test. Okay, then would you like us to tell you how would we manage it? Yes, doctor. Arms. ARMMS. A and R. Risk factor and advice. What do you mean, Dr. Mo? If there is a problem in diet,
I will advise him.
but please say it nice. As you mentioned to me. So the management is arms. ARMMS. You know from day one in the course. So A and the R, advice and risk factor, they come together. What do you mean? So as you mentioned to me that you are eating 1, 2, 3, 4, so I highly advise you. So advice. As you mentioned to me, there is this, so I advise you with this. Okay? So please advise, depending on his factor. Now, the M, medication and investigations. What medications would you give in this case? Guys, iron tablet. What medications? Iron tablets. And in this case, please, you're gonna give iron? Tell him it's tablets. One tablet, you will take it,
Side effects.
Orally.
okay, through your mouth with water. Some side effects for these tablets, which is
Tummy pain.
tummy pain, constipation, dark stool. So please don't stop that.
Medication.
Tablets, and then we'll follow you up.
Keep them
We'll
away from
repeat the,
children.
yes, we'll follow you up and we'll repeat the blood tests later on to see how everything is going. Guys, clear?
If the condition is caused by malabsorption, should I explore the malabsorption and go that way to?
You will explore the malabsorption, but can you manage malabsorption?
No.
So you will refer him to? Because yes, because it's plenty of causes here.
Yeah.
So it's out of your hand.
Yeah, yeah.
Yes, definitely. Yeah, but you're not gonna be able to manage malabsorption, but you will spot it. But do I give him tablets still?
Yes.
Yes.
Yeah,
Until he goes.
clear? But they're gonna take him to manage the cause. But I will manage the symptom.
Now.
Next station. Guys, are you okay?
If the patient is old age, should I ask about flows as well, or
Sorry?
if the patient old age?
One of the causes of anemia, if the patient is old age, and I couldn't spot any diet, any malabsorption, any bleeding, is cancer. Now, what is the first presentation of cancer?
Tiredness.
Anemia. Yes. So
Okay,
yes,
chronic disease can-
definitely, if the patient is old, definitely ask about the cancer symptoms, flows, yeah?
Okay.
100%. Well done, perfect, yeah. Next station. Vitamin B12 deficiency. You are an FY2 doctor in the GP clinic. Scarlett Johansson, 30 years old, presented a week ago with tiredness. Tiredness. Blood results were done. Hemoglobin 10. It's called vitamin B12 deficiency anemia. So hemoglobin is low. MCV is high, very high. 130. Ferritin and the iron are normal. Guys, you know what I'm talking about, yeah? Okay. In a village way. What is the cause of vitamin B12? What is the causes? Could be diet. Perfect. Could be diet. What else?
Pernicious anemia.
Yes. Listen carefully to this point. Pernicious anemia, which is, I don't really care about pernicious, but which is a shape of malabsorption. Again, I don't want. Basically, be careful, because in this case, the patient might have had surgery. What type of surgery?
Gastric sleeve.
Yes, they took a piece of the stomach. It's a surgery that they do to lose weight, and then it affected the absorption of the vitamin B12. Clear?
Okay. So I'm going to ask about surgical history.
Yes, perfect. That's what I'm saying. Surgical history. So diet and
Surgery.
surgical history, and she will give you surgical history, and it is very important station, and it's there. Yes, she will tell you, doctor, I had gastric band, a piece of my stomach was taken because I wanted to lose weight, whatever. It is a risk factor. Then you should manage the risk factor. You will say, where did they take the piece? We need to bring the piece. I don't care. We need to bring this piece. So be careful, guys. She will have past history of surgery. Important, yeah. So that's the cause. What about now? Guys, I don't want to go through the structure again. The station is, hi, I'm Dr. Fatih Biology. Dr. Zahir, can you please confirm your full name and date of birth? I can see from Marid that are coming before. Follow up. Yes, thanks for coming to see us today. Then start. Would you like me to explain the result first, or should you have a chat? Doctor, have a chat. The chat is 3 parts. What brought you for this test from the first place? She will give you symptoms, explore. Then the cause. You need to know the cause. The cause in this case is diet and surgical history. Then the complication of the condition. What can be the complication?
Tingling, numbness, any balance.
Numbness, tingling, nerve problem, yeah? Numbness, tingling, hand and feet, tremors, any nerve issues. Okay? Decrease in sensation. So in brackets, complication. In one word, nerve. That's it. Okay? Now, I will go to the explaining the result. Explaining the or slowly. Yeah? The blood, the hemoglobin,
The vitamin B12.
Okay, I'm talking even that. Here it is written hemoglobin 10, MCV is 120. So I need this as well. I need to tell her, yes, it's vitamin loss, yes, but I need to tell her the results. What is hemoglobin 10? High, low, normal? No, low. What is MCV? Is what? The cell, the volume of the cell. You understand? That's what I mean by, don't worry. Take your time. In saying that the volume of the cell is quite big, she needs to understand simply the results, yeah? Now, what if, because in the exam, one of the cases they brought it diet problem, one of the cases they brought it surgery. Be careful, yeah? That's the two main risk factors. Now, management.
Injection day.
Management. Don't start with injection.
It's written like this.
Where?
In the chest.
No. Don't start with injection. It's written injection and then
Loading dose injection for 2 weeks.
Guys.
Every other day, then tablets.
Guys.
According to
yes,
the condition.
yes. But if you don't have a structure, you will lose yourself. If every station you will start it your own way. I did not say we're not gonna give him vitamin. We will, but I want you always to follow a certain pattern, so you don't forget. That's my main concern. Which is arms.
Okay.
There is a cause. Arms. ARMMS. As you mentioned to me, that your diet is such and such. So I highly advise you such and such as it's the cause. But now we need to give you some medications. Then do the medications. And you understand? Because guys, if you, every station, if you start it your own way, wallah, you will be lost. You will forget plenty of things. In the mock, people don't even believe the things that they forget. Very easy to forget. So just follow a structure all the time. If I have a station that is diagnosed,
Yes.
Why they bring me to talk to the patient if the station is diagnosed? To tell him the cause, to advise him. So the main purpose is advising how to prevent it. So always arms. Okay? So A advice, R risk factor. Depending on the patient's risk factor. So don't tell her, well, if the problem is diet, don't talk about surgery. Don't say, well, and there are other causes which is, you don't need to. That's it. You only advise what the patient has. Then AR, M, medication. What medication do you give? Vitamin B12. So vitamin B12, injection or oral? Injection or oral?
It depends on the course.
Depends on the course.
First injection,
Okay?
then depends on the course.
But always injection at first, guys. Guys, always. I will start, sorry? Yeah, I mean, that's what I'm saying. Always I will start with injection. Okay? So B12, injection. And later on, sometimes, the patient will be giving it every 3 months. You understand? So, but always in all cases, you will start with advice and risk factor, and then injections. Okay? Now, safety netting. What will be the safety netting? And by the way, there is a very common cause as well in vitamin B12 deficiency. Vegetarian? Vegetarian, yeah?
The vegans, especially the vegans.
Vegans. So I know, but I'm just highlighting, you know. Yeah, I know it's in diet, but vegans, yeah. So can you advise them not to be? No.
They can have some changes in their dietitian.
Yes.
Dietitian.
Dietitian who will give them some advice, and even if he's not or she's not vegan, but the problem is in diet, you can always refer to dietitian. But how would I remember dietitian? Because we have arms. A for advice, R for risk factor, M for medication and investigation. What is the second M? Second, multidisciplinary team. Who would you involve here? Dietitian, guys. Okay? Safety netting always for complication, nerve problem. If you have numbness, tingling, and this and that, you know. If the condition gets worse, you know, always safety net. Yeah? Next station. Next station is similar to the iron deficiency anemia. It's thalassemia. Okay? Again, the village way, because the village way last. Not the sophisticated way. The village way. What is the difference between the iron deficiency anemia and the thalassemia?
The iron is normal. Iron is normal.
Okay, guys, the only, I want to ask you, what is the difference? Be like systemic. Say, there's some differences in history, 1IT. And by the way, when I say what is the difference, I mean from a plateau point of view. Okay. Not from a, you know, because hematology is that book, yeah?
It's an ocean. Yeah.
No. From a Plato point of view, when I take history and it is iron or thalassemia, one word different. Family history.
Yes.
Family history. Done? So in the history, what is the only difference? When I say the only, I don't mean the only. As a Plato level, make sure you must not forget to ask about. And in Plato, as a Plato level, she will say to you, my sister. My sister, she's having
Blood transfusion.
thalassemia or blood problem. Should you or tell her what problem and how is it managed? How is she doing? So you understand. So in the thalassemia cases, she will tell you that my sister is having blood, but she knows not gonna tell you. You need to tell her. So always don't forget family history. That's in history. So in history, there is family history, positive. What about explaining the result? When you explain the result, not the only again, like main difference. The iron is normal or what?
Yes.
Iron is normal. So, iron deficiency anemia is microcytic hypochromic. Really? Yeah, microcytic hypochromic. Plus iron low. Okay. What about thalassemia? Microcytic hypochromic. Really? Yes. But iron is clear. So one of them iron is low, one of them iron is okay. What about if they brought for us microcytic hypochromic and no iron studies?
We'll do the iron.
Now, blindly, you will start here on iron. Really, we don't know. You will start here on iron, and then further iron studies. Does that make sense? Because what's common as a cause of microcytic hypochromic? Is it more thalassemia or more iron? So start here blind, Dr. Mo, but what if it was not iron? It's fine. What would iron do to her? In terms of problems, no problems. Yes, it did not benefit, but there is no
problem.
Do you get my mind? So, if in the station it is mentioned microcytic hypochromic, if in the question it is written hemoglobin low, MCV low, MCHC low, but it's not mentioned the iron studies. So your differentials are anemia, iron, or thalassemia. And in these cases, do you need to ask family history? Yes. And in this case, would you give iron?
Yes.
Would you advise about diet if it's there?
Yes.
But you will tell her further investigations are needed, which is iron studies, clear. But if the case is coming and there is iron studies, that is normal. Normal. And the hypochromic and macrocytic. So I think of thalassemia or iron deficiency? Thalassemia. Clear.
In this case, what do we do about the professional diagnosis?
In this case, I always tell you, in the diagnosis, do you need to give one? You can give two in the diagnosis, yeah? Doctor, two, yes, two. Yeah, you can give two different. You say, it could be this, it could be that. It's fine. Okay? So, coming back to thalassemia. So the case, let's start. So in this case, you are an F1 doctor in the clinic. Miss سارة. دايما بجيب الحاجات وتسخن كده وما لهاش لو صح؟ You see, his main concern have something not for you. And what الشيخ he's showing the monster. يعني ايه heart racing وهيدك وبتاع. It's fine, but يعني we need you to last.
بتفلش
بحبك في الله والله. اسألنيش ليه يعني how why ها
كويس
اوكي.
هيفصل
دكتور كونسول تحس كده احنا في عصر المماليك. تحس داخل هخش في سيف كده. يلا يا باشا. You are an F5 doctor in the GB clinic. Miss Sarah, 42 years old, came a week ago for a well woman checkup. Guys, well woman checkup and the well man checkup. Rich people, they go for private and they say we're going for a checkup. So when you see well woman or well man clinic, it's not a brand name like Adidas, like no, it's just a clinic for
he has no
to
symptoms.
check is he well. Yeah, usually no symptoms. That's something checkup. Who will go to the doctor if he has no symptoms? Someone who's really relaxed to go and I want to know what's happening, so it's private, yeah. But it can be in the chest. You can go and say I want to have somebody check, it's fine. But usually people who are posh, they go for I want to go for some investigations. So when you see well man or well woman, it's fine, yeah? To make sure that she's well or not. Anyway, FY to doctor in the clinic. Sarah Jones, 42 years old. She came for a checkup. Blood tests were done. Hemoglobin is low, 10. MCV is low. Iron is normal. Iron study is normal. So is it iron deficiency anemia? No. Now, they did not mention anything else. B12 is normal. So they are telling you it's not the other two. It's not the vitamin B12 and it's not the iron deficiency anemia. But did they give you anything else in terms of to tell you it is thalassemia? No, because there are further investigation to confirm
Electrophoresis.
thalassemia, hemoglobin, electrophoresis. Keep it for now. Put it in your pocket for now. My point is it iron?
No.
Iron normal. Is it vitamin B12? So it is the third one, thalassemia. You understand? So take history as normal. I can see from when they are coming for follow-up with blood result. Yes, nice to see you. Yes, it's nice to see you, doctor. Is it okay if I have a chat? Or would you like to take the result? No, doctor, you can have a chat. 3 questions. Yeah? The first question is what brought you for?
From the first
Test result. Doctor, I was feeling tired, or doctor, just I'm coming for a checkup, whatever symptoms she gave you, except flow. Do you need differentials? No. Okay, you know it's anemia, but you want to know thalassemia or not. Okay, don't go deep into differential. Okay. Now, causes and risk factor in one word. Family history. You are thinking now of thalassemia. Iron is normal, but I will still ask the other causes. I can ask a diet. Is it a problem? No diet. Can I ask smoking? Yes, it's fine. But you must involve the family
history.
and she will give you positive family history. She will tell you my sister is having a blood problem, a condition called thalassemia, or even if she doesn't know, it's fine. Blood problem. Then, is it diagnosed? Did they tell her what? Explore, yeah? Is she on any medications? How is she do? Take your time. Because it is the key here, yeah? Now, anybody else in the family apart from your sister? Okay. What else when she gives me positive family history? What else should I ask about? If she gives me... Now, guys, I'm breaking it down, yeah? The station started with anemia. And then when I started taking history,
Iron is normal.
okay, I asked about tiredness and symptoms. And then she gave me symptoms. And then I came to causes. And she gave me family history. Are you following?
Yeah.
Now, what should I ask about?
Regular blood transfusion.
You plan to have
Children for her.
Brother, before you ask about is she planning to be pregnant, ask is she with anyone or not?
As a partner or not.
You understand? So, do you get pregnant and then you have a partner, or you have a partner first? So always ask, because it will look odd. You know, sometimes in history, you can ask a question and they say, Dr. Mo, you are annoying. Why you just like... No. The patient, they can tell you when you say to her, are you planning to be pregnant? Doctor, I'm single. And she will tell you this, yeah? I'm single. She will be offended. If you are asking her about pregnancy and she doesn't even have a partner. So always start in a chronological order. You first have a partner, then you have sex, then you be pregnant. So if you want to ask about kids and stuff, always say, are you sexually active? Yeah, do you have a partner? Yes. Do you have any kids? Are they well? So my point is, once she tell you that family history positive, Dr. Kunsaw, always carry on with family. What do you mean? I want to know, does she have a partner or not? And I want to know where is her partner from and where is she from? Really? Yeah, because Mediterranean
People, yeah.
female Mediterranean partner, and she could be carrier, doesn't have symptoms.
Yeah.
He could be carrier, and they both bring a beautiful baby who's sick. You understand? So that's why. Always start with the what brought you, symptoms, then dig to the cause. If she gives you positive family history, please go with the family, because in this case in the history, you need to establish. Because if she is Mediterranean, her sister, she is sick, her husband, her partner is Mediterranean, they will go for genetic counseling. And they will go for some tests before even they have the baby. Are you following me?
Yes.
You are looking to management. You take history to help you in. Because in this case, yes, family history, inheritance is important, clear.
But if you ask you where is she from, she said, I'm from England, I'm from the UK. She is originated.
Originally, guys.
You can ask about originally.
Yes.
It's not
Yes.
offensive
No.
question.
Brother, anybody lives in UK? Anybody here lives in UK? You know when you apply for a job? Are you white? Are you black? I'm serious.
Yes,
Are you mixed race?
even in the GMC.
Are you Arab? So don't worry. I mean, in the GMC is okay, and we are here in the GMC. إحنا الحكومة. Yes, ask originally, but obviously, signpost it. Well, is it okay if I ask some questions? It may sound quite intrusive, but it's important in this condition. Yes, may I ask? And then start with any question that sound intrusive. Because if I say to you, where are you originally from? That's not a normal question. I know, I agree with you. So always signpost. It's important for my case. I'm not here to take your phone number and WhatsApp number and talk to you later. No. It's important. Okay?
So we ask if her sister is only a carrier or...
You don't. She doesn't know. She wouldn't know. You ask if her sister has symptoms.
If she's really
She was in regular blood transfusion.
Guys, yes. That's why I said to you, if she gives you positive,
She will not have any symptoms.
positive, yes, my sister has a problem. I've just mentioned like 3 minutes ago. Dig deep. What is it diagnosed? What did they tell her? What medication is she on? How she managed? How she doing? Yes, of course, yeah. But let me tell you something. Thalassemia. Thalassemia are how many types?
2 types.
2 main types.
Major,
Major or minor? Major, they die. End of the story?
No.
What major they die?
Sorry?
Which major?
There is guys, there is 2 types of thalassemia. What do you know of major or die?
Alpha thalassemia.
It's many subtypes, that's what I'm saying.
But major,
What type that you will have and will be alive, that's what I'm saying. Sorry?
Trait. Thalassemia trait.
Yes, but,
Beta thalassemia, all of them will live.
sorry?
Beta thalassemia, all of them will live.
Yes. And alpha?
Only the major will die. Only if you have
No.
2 or 3.
they do not die.
No. When I say they die, guys, they don't present 40 and 50 years old. Yes, they will die early.
2 years.
Yes, that's what I'm saying. 100% they will die early. So my point is, even when you are asking, because her sister, she's having a condition, but it's not gonna be out of many things, because some of them they die within limited amount, 2 years, 3 years. You understand? So my point is, you don't need to go into details, because later on she will have hemoglobin. She will be referred to guys, hematologist. This patient, she must be referred. So my job here is not really, no, my job is genetic counseling, to refer her for the partner, to advise her if the partner is from Egypt, Greece, Mediterranean, male, Mediterranean female. That's my job. What would I give her? What would I do to her? This patient?
Advise her to do a
Okay.
genetic counseling before.
What would I do to her? Would I give her iron tablet? No. Okay, so the main management here is counseling. The main management here is telling her, as you mentioned to me, your sister, such and such. Yes, I'm suspecting such and such. And in these conditions, you've mentioned whether your partner is from whatever you are from. So high possibility of that. Are you planning to have a baby? So these stations is just all about talking. Would you do anything to her? No, guys, nothing. But what is the management I will do really? Refer to hematologist who will do further investigation. Hemoglobin, not your job. Clear? So thalassemia in one word. In history, family history. Dig in family. Ask about the partner. Ask, is she single? Does she have a partner? Is she planning to be pregnant? Having kids? Yeah? In management, genetic counseling. Okay? Do you want to give her IV anything, a blood transfusion? Guys, nothing. This case, nothing. Is it confirmed?
No.
Why? Yes. So guys, it's not confirmed. So always please, I suspect. Don't say, well, you have thalassemia. No. Because what will confirm it? Further, because there is a station coming, similar idea, and most of you argue, doctor, it's multiple myeloma. Guys, it's not. Multiple myeloma. Dr. Ben Johnson protein, PLAB 1, Ben Johnson protein. Guys, sorry? Guys, it's not confirmed. You have to do bone marrow biopsy. It's common now, and many doctors, they do think that Ben Johnson protein positive, yes. So it's multiple myeloma, no. So some cases, like this case, thalassemia borderline, she will give you everything, but they are not expecting from you to say thalassemia, because it's not, unless you confirm it. Next station.
So what do we say as a diagnosis?
Well, you say, first of all, how do you say provisional diagnosis? You bring the positive. No, the positive. Well, from the history that you've given me, you've mentioned that you have such and such, and in the blood, such and such, and you also mentioned that your sister. So, we are suspecting a condition, that usually runs in the family, which is a blood disorder called thalassemia. So, before I said thalassemia, I break down everything. Okay, what if? Because you confuse it and it affects your communication skills. What if you told her, do you know what your sister has? She said, yeah, thalassemia, doctor. Is it gonna be the same provision, the same way of talking to you? Would you say to her, do you know it is a condition of the blood? No, she knows thalassemia. Be careful, active listening. Yeah, because she might say, no, I don't know, and she will say, yes, she had thalassemia. Do you know? Yeah, I know thalassemia is such a, so please. So when you give provisional diagnosis, you have. I'm suspecting. No, you have. Yeah.
Yeah.
Do you understand what I just said now?
Yeah.
Guys, the filter the scripted from the unscripted. How?
Active listening.
Sorry?
Makes sense.
Yes, the one who makes sense. The one who, because I can filter you now with one finding. It's the same station.
Yeah.
The same. People say, what is today's station? Do you see any new stations?
No.
Seriously. Whenever do you see any?
No.
But they all new. What do I mean by the all new? No, one line. One line. They put one thing. And then they are sitting like this. Yeah, wallah, sitting like this. Next. And they can give you 111. And you said everything. Yes, you said everything. But they changed one thing, that they show or they filter who's following and who's not following. Like this thing. Some doctors will say, well, from the history that you've given me, and according to this and that, you have a condition called thalassemia. Have you heard about it? Yeah, brother, she told you 1 minute ago. My sister has thalassemia. So be relevant. Be active listening. Every station will change, not in the station, it's changing the pathway. But they are all the same. Clear?
Here in this case, I think you should also explain one more thing, that she might be carrier, not like her sister, she needs blood transfusion. In case if you are suspecting.
But that's what we said. We said, if we are suspecting, but she might be carrier. I'm not gonna go into the further, because the further it is that. Don't worry. The further is the hematologist. So I'm not gonna say here, are you carrier or not? Guys, you're not gonna say to her in the same station, carrier or not. Why? Because you have a patient. You're breaking down things to the patient. I might be a carrier. Yeah, can you please tell me more about it?
But wouldn't this be very difficult news for her to know if she doesn't know about thalassemia? And then you're telling her you might be having thalassemia.
What? No, if she doesn't know about thalassemia.
If she knows her sister has thalassemia.
But I'm not gonna tell her carrier now.
Okay, so how will you break down this to her, that you have a simple condition of thalassemia?
No, I'm not gonna say simple. It's not simple.
She doesn't have symptoms, right?
No, I'm not gonna say simple. I'm not gonna say complicated, because I don't know what's gonna happen further. But my point is, always used to, guys. Always be used to. Yeah. If you're gonna tell the patient something that's not simple to understand, you understand me? Like thalassemia, don't follow it by another thing that is not simple to understand. What do you mean? You know the case of subarachnoid hemorrhage? Yeah? Some doctors, well, from the information you're giving me, and according to my whatever, I'm suspecting that Mr. Ali is having a condition called subarachnoid hemorrhage. Then, and I'm afraid he will need palliative care. Brother, when you talk, word, break it down. Word, don't say two things that are not
Clear.
So I would not say I'm suspecting you could be, and you may be a carrier. I can say it, but you have to
Explain it.
Do you understand my way of? You don't say two words that needs explaining in one sentence, but you can say it, but not together. After she already understand what thalassemia is.
Can we ask her, as your sister is diagnosed, so have you been ever doing for any genetic testing?
I
to know
said,
you are the carrier?
I've just said, when she tells you that her sister is not well, I said go deep. If I say it, deep, what she has, since when, is it diagnosed, what did they tell her, how is she managed, how is she doing? Yes, okay. I think we've given this case too much time.
Okay, the last
So
point
next
in the
station.
management.
Sorry?
As the last point in the management, I would advise her if is planning to get pregnant whenever
She will
have a
yeah.
genetic consultation.
Yes.
Yeah.
Next station, alcohol hepatitis. Alcoholic hepatitis can come as, listen carefully. Alcoholic hepatitis can come as examination station. What do you mean? Yeah. A patient is coming with abdominal distension. How would I know it's examination and the history?
Find mannequin.
Assess.
From the mannequin.
Okay.
When you go in, or you will say examine. So I will know. How much history? 2 minutes. Guys, that's the most important advice in examination. However, it can come as test result station. How would I know? How would I know? It is test result station. How would I know it's not examination station? How would I know it's test result?
In the stem it's written.
Sorry?
Do you give us results?
Yeah, they will give us result. Okay? So you will have in the question test result. So now, this is test result station. Guys, sometimes we laugh about things, but you only realize it in the mock. In the mock. In the mock, people go, Dr. Rada. Come, look. What is English? راح فين? Yeah, listen. I know I'm very bad, wallah. Listen, wallah, I know I'm very bad. But that's why I said it's a family-run business. So if I would have gone home, I would have slept. I would have wake up seriously 8 in the evening, and that's it. The day's gone. So يعني بسند على my brother يعني فاهم اللي هو ايه okay I will take some time scratch my back so I scratch your head so it's you know so I'm not gonna take long. I'm about to finish. I love you.
IBS.
لازم يعني. They have to be happy. Yeah. Alcoholic hepatitis, in this case, it is not examination, it is test result. And how would I know? It's very important. If the station said examine, if the station said assess, if the station you open the cubicle and there is a mannequin abdominal, it's not history taking. It is Assalamu alaikum, 2 questions and then examine. But if the question said test result 1, 2, 3, 4 and talk to the patient and the patient is coming for follow-up, then I know. Clear? I know it is that station if there are test result. Okay, this is station alcoholic hepatitis. Again, we're gonna talk in the village way. Alcoholic hepatitis. What will, when we do blood investigations, liver function test.
High.
What is high? لا مش ميكي ماوس قوي كده. High. When we do liver function high. I don't know. What, there is something specific. Gamma, glutamine, transferase. That's specific. Now alcoholic. You understand at our level? GGT. Alcoholic.
Ultrasound as well.
Sorry?
Ultrasound.
Yeah, that's further. I'm just talking as a basic of blood. So blood, gamma, glutamyl, transferase will be high. Okay. If in the station they gave you deranged liver function test and they gave you gamma glutamyl transferase high, now at the door, you know you're gonna be discussing what?
Alcohol.
Guys, clear. So please don't waste your time. Please ask about alcohol early. Okay. What if they give you deranged liver function?
without GGT.
S got high, ALT, AST high, but they did not give you gamma glutamyl transferase.
Differentials.
Now the differentials will be a bit
Wider.
wider simply. Do you understand? Am I going too fast?
No.
So if gamma glutamyl transferase is given in the blood result, focus in the history, ask about the symptoms that for which he came, and ask about the cause. The cause is one word: alcohol. Clear. But if they talk from the question, the GGT, and they just give S-GAT, which is ALT and AST high, but there is no reason yet.
Differential.
Then differential. Clear. And the differential, okay, Dr. Mo, why did they give us the test result? Just liver function are deranged. What are the causes? You go and give differentials. Okay? Even though there are blood result. Yeah, but there is no reason. So, simply, at our Mickey Mouse level, what do we need to know? We need to know there is a case that appeared in the exam, which is this one, alcoholic hepatitis, liver function tests deranged, and gamma glutamyl is increased, which is what? Alcoholic. Okay, what is the second station? Liver function tests are deranged, alkaline phosphatase is high. Stone. Yes, you head toward gall bladder and common bile duct stone, any pain, yellow discoloration. You understand? It is a stone. I've explained jaundice before. That's why I'm going a bit quick, because you know. Yeah? What if they give me the blood test, liver function test are deranged, but no alkaline phosphatase, no gamma glutamyl transferase then? Sorry? No, I'm saying they did not give.
They did not.
That's what I'm saying. Then give differential, because you don't know. Are you lost? Sorry?
Can I have one?
Yeah.
Yeah, Victor, because this is my last day, so I don't know if we can do another session. For
You can.
Because, Doctor, maybe we will not have a chance to do it again.
About the teaching.
Yeah.
We're gonna do it tonight. If you look. Speak to doctor, guys. I'm sorry. If any of you wants to, you have the teaching, feel free. Yeah, some doctors are on. I just thought I don't want you to miss it and have the teaching as well. You have both, but it's fine. Anybody wants to attend the teaching? But we're gonna carry on the teaching. Are you leaving at a certain time?
No, but I don't know. Maybe he will leave.
No. He's not gonna. No, don't worry.
It is my last session today.
Don't
so
worry.
I
He's
don't
not
know.
gonna. He's not gonna leave. I was just making. They can't leave. This is just when we talk to the patient, yeah, we tell him, do you want to stop smoking? It's up to you, but you will stop smoking. You understand it that way, So it's no, don't worry. Yeah. Anyway, so in this case now, that they will give you gamma glutamyl transferase high. Then guys, please only talk about alcohol. But if they don't, so that means it's hepatitis. Yeah, hepatitis. But what is the cause? We don't know. So how many questions should I ask if I don't know? So if I know, so you don't get lost. If the question said AST, ALT high, GGT high, is it blood result station? Yes. In the history, am I gonna be focusing in alcohol history? Yes. Okay. What is the second scenario? No. Just AST, ALT high, nothing else. So in the history, what will be different? Is it gonna be just alcohol?
No.
Alcohol is one cause of hepatitis. So how many questions then? Guys, not much. Write them down. Write them down in history. In history. I'm not gonna say about GGT because it's only alcohol, right?
Yeah.
Only alcohol. If GGT is high, written in the question, my history is only alcohol. What if it's not mentioned? The GGT, but it's mentioned ALT, AST. Right? 5-6 questions. Number 1, travel plus or minus eating out. Really? Yes. Number 2, IV drug abuse plus or minus sexual history. Okay. Number 3, blood transfusion plus or minus surgical history. Number 4 is the alcohol, because I said to you, in this case I'm discussing, there is no GGT, so alcohol is the cause.
Yeah.
Anything else? So travel, eating out, IV sexual history, blood transfusion system and surgery, which is procedure, alcohol.
Piercing and tattooing.
Sorry?
Tattoo?
Tattoo and piercing, I consider it as it goes with the blood
The
transfusion.
surgery,
That's
goes
why.
with
But
the
anyway,
surgery.
tattoo and piercing, yeah? Have the piercing, huh? Tattoo piercing. Go every day. What about piercing? One after piercing. Understand? So be careful. If GGT is mentioned, only alcohol. If it's not, and by the way, this is a recap of jaundice. Recap of?
Jaundice.
What do you mean? Any case of jaundice, these are the questions. But how did you write? Why did you write them like this? Travel and eating out. And guys, when I say travel, eating out, and contact, add one word. Travel, eating out, contact. Hepatitis A. IV drug abuse, sexual history, blood transfusion, tattoo, piercing, sexual. B, C. Alcohol. Alcohol. And this is jaundice. Clear? As I mentioned, it is relevant. So, past history of medical, no, relevant. Okay? She's sitting doing this. What about Gilbert? Gilbert is just stress. Gilbert is everything is normal. They only show symptoms under so ask stress.
Family history?
Yeah, family history as well, yeah. 100%. Sorry?
You don't need to ask about stress.
What do you mean?
In jaundice, you mean?
هو جيلبرت اصلا في
I'm talking about jaundice, yeah. That's all.
جيلبرت ما فيهوش درينج ليفر فانكشن
Guys, let's no. Gilbert, guys.
ليفر فانكشن ستيشن
Guys. No, guys, she didn't, والله. She just said Gilbert.
لا قال الجلبرت
No, she said a bit. Yeah, no, she didn't. I'm trying to get her in trouble. Okay. Yes? Sorry? Recap. 100%, of course. So, I said we have two scenarios. Blood result. We have one scenario, blood result, where they mention in the question AST, ALT high. That's it. Which means they only mention hepatitis. In this case, I need to know the cause. What is the cause? The cause, I said, the first line. Ask about travel history. Eating out, contact history. In brackets, hepatitis A. Number 2, IV drug abuse. Plus or minus?
sexual history
Sexual history. Plus or minus? Blood transfusion. Surgery. Piercing. Tattoo. Yeah? And then, which is hepatitis B and C. And they include family history as well. Yeah? And then I said finally is alcohol. Alcohol is what? Alcoholic hepatitis. So the causes of hepatitis. Hepatitis A, the questions. Travel, eating out. Hepatitis B, IV, piercing, tattoo. Hepatitis C, family history, both in the middle. Alcohol, alcohol history. That's it. And then I will go to explaining the result. Okay. Explaining the result, yes. But you said there are two scenarios. Guys, understand that I'm not here to make you memorize. If the question said ALT, AST high, do you know the cause?
No.
No, then you will explain that there is hepatitis, inflammation in the liver, but we will do further what? Like what? Like GGT, alkaline phosphatase, ultrasound.
Virology.
Sorry?
Virology.
Virology. However, if the question said GGT, they are telling you it is
Alcoholic.
alcohol. So what is the management?
Stop drinking
Alcohol. That's it.
And refer to gastroenterologist.
Yeah, mainly lifestyle. Alcohol. Plus, because it's hepatitis, then referral. Okay?
If you find positive travel history, contact history, and it's hepatitis A male, you have to ask about fever, flu-like symptoms.
Yes.
diarrhea.
Yeah. We know that the cause of hepatitis A.
It's like the start of the
What antibiotic would you give in hepatitis A? Okay, great. Huh? No, I like this one. Okay, guys. So, by the way, guys, Dr. Maha, we need to. So I only discussed two cases here. alcoholic hepatitis and what?
Hepatitis.
And alcoholic hepatitis and only hepatitis. So I discussed 2 cases. I don't want to be lost. 2 cases. One of them, if GGT is positive, which only talk about alcohol history. One of them, there is no GGT. There is only AST, ALT, which here I will take differential.
Yes.
Then explain the result that is given, which is liver function. It is liver function. Then manage. I said in management, what is the structure?
Advise.
Arms. If the case is alcohol, GGT is high, alcohol problem.
Stop alcohol.
A and R, advise a risk factor, which is alcohol. MS. M, medication investigation. M, multidisciplinary team. S, safety netting. So in this patient, you need to refer to specialist gastroenterologist. What else? Can we refer him for the alcohol?
If he
Yeah. So
if he wants to quit,
No, he must stop.
he has to stop now.
yeah, only 2 cases. We tell the patient stop now,
Pancreatitis.
Acute pancreatitis.
and the rest cut down. No. 2 things mainly. When I say mainly, I mean PLAB 2. Yeah, guys, I don't want to understand the word mainly.
يبقى only.
It's a PLAB 2. I'm directed to PLAB 2. 2 cases. One of them doesn't come anymore. Food examination, diabetic food. Yeah, and the second one, which is alcoholic hepatitis. You don't say to him, I highly advise you that you could brother stop. If you don't stop, you will
You will
die.
die.
So
So in
let's
the
move
his-
forward.
Yeah, in the
We have
history,
taken longer than what we say.
in the history, I would go for if alcohol, how much or how frequent,
Yes.
but I wouldn't go for case TW.
No, just how much? Yes. Just in these cases, if it's alcohol, how much do you drink?
Yeah.
Since how long? Yeah. Okay, guys. By the way, we have discussed also jaundice. In this case, if a patient is coming with jaundice,
But we ask about the change in the color of stool and
no, yeah. And when I said we have discussed the only, I mean differential. As a differential for jaundice, yeah, as differential. But obviously jaundice, yellow discoloration. So explore where, how, and always ask. It could be obstruction, dark stool. You understand? Dark urine pale stool because it's obstruction, and in this case, because the etching and the alkaline phosphatase, so it's a bit wider. But mostly, my differentials are these. Okay. Let's move. Yes. I've discussed jaundice in the old course. Just one lecture is jaundice, yeah? Next is polycystic ovary. Yes.
I have a question about the hepatitis. In this case, we have to refer you to admit, so I will further investigations, but
In this case, if it's a hospital, admit.
well, it's in the GP.
But in the GP, refer. Yeah, and it's not urgent. Yeah,
For further tests.
yes, but it's not urgent, you know. Be referred to gastroenterologist. Yeah.
Doctor, one more question. They can't pass alcohol hepatitis, okay? Do you ask about cage, TWD?
No. Guys, there are questions for alcohol, yeah? Alcohol, cage, TWD. The cage and TWD only psychiatry. But this case, only the question for alcohol. What do you drink? How much? Since how long? You understand? Don't go for the cage TWD, yeah? Okay, you are an FY2 doctor in the GB clinic. Sandra Bullock, 29 years old, presented a week ago with acne and irregular period. Acne and irregular, okay, acne and irregular period, yes. Blood tests were done and shows. Guys, I give words, yeah? Acne and 2 things. Blood tests were done and shows LH is high. And the ratio LHS to FSH is high. All right. BMI high. Talk to her, address her concern. Pregnancy test is mentioned, negative. Okay. Is it blood result station?
Yes.
Okay. What is the presentation?
Acne.
Acne and irregular period.
periods, obesity,
What is the, and BMI high, obesity. What is the blood test shown?
LH higher than FSH.
The ratio 3 to 1.
3 to 1.
Yeah. What do you think?
Makes sense, polycystic
Sorry?
From the stem you will know polycystic.
Yeah, that's what I'm saying. Do you need differentials?
No.
No, but
It's not confirmed.
good. We need ultrasound later. We know that. But what I'm saying, do you need to go deep into differential? That's my question.
No.
Is it as if the patient is coming with irregular period only,
No.
or acne? And no, there are investigation here.
Okay.
You remember PLAB 1? When you look at the question, LHSFH 3 to 1. You know, PLAB 1 was like this, yeah? You look at the word. 25 years old, travel to Thailand. STI. You know, you look in the question. You look for Spain, Legionella. You understand? PLAB 1. PLAB 1 is like, you look for the country and you look for the one word. This is the same. So, it's a blood test, but don't go into details in differentials. So, same structure. But write down, I will follow the same structure. Would you like me to explain first or history? Doctor, take history, what you want, it's fine. Then what is the history here? What is the history here? So write down the question that is specific, irrelevant. Ask about the acne, number 1. What do you want to ask about the acne? I will start my first question by what? What brought you to this blood test? Doctor, because I had acne. So, number 1, explore acne. Number 2, explore the irregular period. Yeah, the two questions, the two words that are written, you need to
Explore.
guys do not memorize, please. Which is what brought you for this result. Then what else you need to ask about?
Wait.
Any unusual hair growth?
Hair growth?
Hair.
Abnormal? What else you need to ask about? Just relevant.
Discharge, nipple discharge from the
Perfect.
mood.
I want to go a bit late, but perfect. Mood. What else you want to ask about?
If she was trying to get
Weight gain.
sexual history.
Lifestyle. Okay. Lifestyle. Guys, everything you are saying is right, yeah? Everybody saying something is right. Lifestyle, yes. You will be shocked. What is the management here? Lifestyle. Guys, that's what I want you to know. Wallahi, this is bad too. Polycystic ovary, lifestyle management, and history. Because all what you're gonna do is lifestyle. So lifestyle is important. Dr. Mo, is there anything to remind me? In the station, just read. Read the question. Okay, acne, explore. Irregular period, explore, and then this in bracket P4. All P4, yeah? What is P4? Pregnancy, period, pap smear, health. All of them are important. All P4? All P4 here is important. How old is she?
35, 40.
29 here. Guys, P4 is a must. Okay. And also the PMI, is it written in the question?
Yes.
So all one word, DESA. Important. And the history is done. When I say done, mainly, that's what we're gonna ask about. Period. DESA. Acne. Abnormal hair growth. What else? Medication history. Medication history. Family history, and end of the story. We're not gonna increase anything else. So medication history, family history, and the few words we mentioned. Acne, abnormal hair growth,
So you have to check about the mood.
BMI, DESA. You said mood, I said yes, mood. I said mood, yeah.
Yeah.
Yeah. BMI, DESA, and that's it. Okay. Then, what? Explain the result. Explain the result simply. What is polycystic ovary?
Multiple cysts.
Cyst in the ovary. Guys, cysts in the ovary. That's
Fluid.
how simple.
Fluid-filled
Please,
sacs.
sorry?
Fluid-filled sex.
Fluid-filled sacs in the ovary. Don't go into, okay? Which leads to what? What is LH and FSH?
Fertility hormones.
Hormones. So affect the hormones in your body. As simple as that. Hormone imbalance. Simple. I said to you, video, record yourself and check how you talk. Sometimes you talk as if you are talking to specialists. You know, we have found that the LH is high. If it's, do you understand? Yeah, I understand. Well, the patient's going to say in the exam, no, I don't. Yeah. Then you come out, I failed, but the patient was happy. He was, do you understand? Assess these knowledge. He said yes. Yeah, the more you will say yes.
Yep.
LH? Yeah, LH. SH? Yeah. MH, yeah, Muhammad. So please, he will say yes, but it's not yes. So please make sure you are simple from the start, okay? Because the patient is not trained, they don't tell him. If he tells you LH, LH, brother, LH. Don't say to him, no, I don't know. You understand? So please, you be simple from the start, okay? So that's the polycystic ovary. Now, what is the management? Now, guys, are you lost? The history is done. We said the history point. Explaining the result, we've mentioned it. Management in one word, DESA. Your job is DESA. That's it. Then, what are you gonna do? Refer to gynecologist. Yeah, you will be giving him medications. I don't care. Which means that first talk about lifestyle, because that's your management. That's the management. Then refer to gynecologist. Okay, that's the main thing. And always, if the patient does it affect the fertility of the patient?
Yes.
So if she mentions, I'm afraid, yes, in some, but is it 100%? No. Some patients, some females do have polycystic ovary, but they
get pregnant.
Okay. What if, doctor, it's that type of a case that I cannot get pregnant? Is there any way?
Yes.
IVF.
It's affecting both ovaries.
Another good answer. Yeah, but you can say there are options, but we can discuss this later. Because not all females who have can't get pregnant. Because not all of them. Okay? So, the question, start, focus history, ask the symptoms, hair growth, acne, BMI, ask about mood swings. Dr. Kumsam ما اقدرش. Ask before, then explain the result. When you explain the, oh, there is a very important question as well. Always ask about, did we mention family history here?
Yes.
We did, okay.
Yes, medication family.
So, medication, family history. Okay, now, further investigations when you manage. Don't forget ultrasound, yeah?
Yes,
Okay, scan. Okay, refer to? Gynecologist, okay. You know from lab 1?
Do they understand their gynecologist?
Of course. Yeah. You know from lab 1? What condition that can this patient have as well? Sorry? Diabetes. Perfect. That's what I was waiting for. Diabetes, yeah? So can you ask about it directly? Any medical condition like diabetes? Yes, you can, yeah? Premature ovarian failure. Premature ovarian failure. I will mention it here because it's related, close. And there is, what is the most important? Guys, when I say most important, I mean for class 2, there are things that they want to hear. Premature ovarian failure. What is the name? From the name, what is the meaning of premature ovarian failure? What is the meaning of it?
Ovaries stopped working early.
Sorry?
Ovaries stopped working early.
Yeah, the ovary stopped working early. Premature ovarian failure. Or premature ovarian insufficiency. In these cases, be careful because you must, because not yet, you are not sure yet, in the station when I read it, you'll understand. Not confirmed yet. Be careful, ask about surgical history in these cases of
Hysterectomy.
ovary. Because sometimes the ovary could be removed actually. That's why, okay? When you have the question, but just keep it in mind on the side now, yeah? The question is RNA false doctor in the Obs and Gynae department. Maria Taylor, 26 years old, presented a week ago. Okay.
26?
Yeah, because it's premature. She's not gonna be. It's young. Yeah, premature. Presented with amenorrhea. What is the meaning of amenorrhea? No period. Hold the word because it's your history. Guys, wallahi, your history is in the question. She presented what? Amenorrhea. Can someone translate it into one word that will give me plenty of questions? P4. Amenorrhea is period. So P4. So on this station, P4 is a must. By the way, some of you might be like thinking, this is like very stupid way of teaching, very simple. Guys, that's why you remember. Amenorrhea, what is the meaning? Late period. So, Bismillah Rahman Rahim, period, when, how, when did the period start, when did the period stop, family history of problem in the period, you understand? It's plenty of questions here. Do you want to know if she had kids or not?
Yes.
Is it important?
Yes.
Which is pregnancy. So P2. P3 pills, do you want to know?
Yeah.
Yes, it's one of the risk factors. And sometimes they give them
Post-pill amenorrhea.
COCP. You understand me?
Yes.
So the whole history. Yakmun, what is Yakmun in English? Huh? Yeah, the whole history is in this world. Amenorrhea.
Evolves around.
Sorry?
Evolves around.
Evolves around it.
Yes. So amenorrhea. Estrogen is low. FSH and LH are high. So estrogen is, this is the key. So in this case, estrogen is low and they are telling you that there is amenorrhea. What is the relevant history? It's all blood result, yeah? You have test result. Estrogen is low. That's it. LHS and FSH are high. So, your senior believes she has premature ovarian failure. Believes, no confirmed, nothing. Go and have a chat with her. So, is a blood result station?
Yes.
Yeah, there are blood result here, yeah? So, history, explain the result, management. In the history, what is the relevant history?
P4.
Give me words, so we finish the history. This is the history, that's the relevant one. We know, the first question, what brought you for this test, doctor? Because I have.
Amenorrhea.
So hold the word. Come.
Since when?
When
The last time.
did it happen? When was the last time you had the period? When you were having the period, was it regular? Was any bleeding in between?
Any spot in between.
What about the family history of period? I'm not saying family history, but I'm saying the period in your family. You understand? In your sisters and your family, yeah? That's the period. Number 2, what is the second word? Relevant history?
Pregnancy.
Pregnancy. So sexual active or not? Having kids or not? Third B?
Pills. Did you ever
Pills.
use?
Have you ever taken the pills? By that I mean the contraceptive pills. Okay. What else did I say? Keep it on the side?
Family history.
No.
Surgery.
Surgery.
Surgeries.
Have you had any surgery before in your lower tummy? Okay. Have you had your ovaries what? Because as simple as that. A patient had something in the ovary. The ovary is removed. There is no period. A risk factor. Okay. So family history, surgical history, symptoms P4. This is the station. Guys, okay?
Yes.
Wouldn't it be weird to
So?
ask her about the period history of her sister, of her mother?
No?
No.
If not something weird,
She knows.
post.
They have sisters?
Yeah.
They have mother.
Yeah.
Yeah, they talk.
Okay.
All the time.
Seriously, it is friends talk about these things.
Okay.
No, it's 100%. So
Yeah.
You can say.
you understand?
Okay.
Yes, so when you explain the result, sitting into laughing وبتاع وعلى كده relaxing كده وبتاع. ماشي. Explaining the result. How would you explain? Guys, history is finished, yeah?
Yeah.
Can you recap the history for me?
Yes. So first
Recap it from the, yeah, I need it like this. Recap it from the question. I don't want someone to, from the question. First of all,
we understood she is having primary ovarian failure or insufficiency.
yes.
All right. So we need to check the symptoms. She came for amenorrhea.
Perfect.
explore the amenorrhea,
Perfect.
And explore about family history of periods.
Okay.
Okay. After that, explore what are the risk factors of having this amenorrhea. Did she have any surgery before? Is she taking any oral contraceptive pills because it's a risk factor? And before pills or pregnancy or
Period. Okay. Surgery, family history. Then anything else you want.
Any other symptoms of this insufficiency?
Perfect. Any other symptoms like maybe hot flashes, maybe doctor painful sex, but yeah, which is what brought you. She will tell you. Okay. Now, provisional diagnosis, which is explaining the result. So please, if you leave the station without telling her about the estrogen and what is estrogen and the 8 is low, and the LHS and the FSH are other hormone that are, wallahi, you're not gonna pass the station because the station said explain the result. So please take your time. Okay? Doctor, will I be able to be pregnant?
There are options.
Always guys play it safe. يعني بص حط مصطفى واتش الكاميرا. Always be safe. Can she be pregnant? Maybe. Can she not be?
You still have the chances.
Yes, okay?
You still have the chance.
So always play it safe. You remember Breaking Bad News, Joshua? Doctor, is he gonna die? Allah, maybe yes, maybe no. Doctor, is he gonna have brain damage? Allah, maybe yes, maybe no. You understand? Because you don't know. After the surgery, you will know. So always play it safe because you don't know. And we don't know here, yeah? Is it important what you are saying now? Imagine if you said to a female, you will not be able to have babies. How would she feel? Huh?
Angry.
Then a month later, she's pregnant.
Angry.
You understand? So
Come angry later on another station.
later on, angry. What happened? Your colleague told her she's not able to be pregnant, but she's pregnant.
Angry patient.
Angry. She shouldn't be angry.
Huh?
She shouldn't be angry if she gets pregnant.
But it's because no, she will go through hell through that time until she gets pregnant. Management. Don't forget. What did you say in management?
Or advice.
What is the main management here? Lifestyle. Lifestyle. Don't forget lifestyle. Yeah. Diet, exercise, ممكن alcohol. Yeah. Lifestyle.
Sometimes they
Would
have
you like to give her medication? Sorry.
Sometimes they have very good lifestyle that they have to go for the medication.
Yes, but that's what I'm saying. ARMS is advice, risk factor, medication, investigation, multidisciplinary team, safety netting. What is advice and risk factor?
According
They
to
say.
Lifestyle.
According to what is the medication and investigation? HRT and COCP. They give them sometimes as a medication. Investigation,
ultrasound,
scan,
scan.
multidisciplinary team. Refer to. You said it. Yeah. This. على فكرة برضه بحبك والله. والله. والمالديف جميلة على فكرة. I love Maldives. والله المالديفز ده بص.
أنا مصري معاك. مش مالديفي.
اخواننا من المالديف.
لا بجد it's a very nice country. Very nice. Osteoporosis. جروب الفوق. You are an FY2 doctor in the orthopedic department. Julia Robert, 65. Not young, 65. Presented 3 months ago. Guys, understand the question. With fracture in her wrist. Okay. She has been treated. She has been managed from an orthopedic point of view. All right. DEXA scan was done. Shows osteoporosis. Do you need any more investigations here?
No.
My point is it diagnosed?
Yes.
Do you want to take history for the fracture?
No.
Why? How did that happen? But I can say, I can see from my note that I had a fracture.
Like a rapport.
Yeah, rapport is a part of rapport. And the best start. How is your hand now? Are you able to move your hands? Everything okay? Yes. Well, the reason why we are here to discuss the scan. The DEXA scan that we did, because sometimes when we have patient with certain type of fracture, we suspect a condition called, can I say it?
Yes.
Will I be selected? No, it's written in the question. Osteoporosis. Doctor, they will know I know the decision from before. Yeah, brother, they told you osteoporosis. Don't worry, you can use it early. Because you want to start your station early.
If they write DEXA scan result,
And no
negative 3 or negative 2.5, I can say osteoporosis.
At this case, you're not sure. It's different. He's saying if they mention DEXA scan,
The number itself instead of
the number, there is number for osteoporosis,
Yes.
which is
Negative 2.5.
Minus
more than,
More.
yes, 2.5. But in these cases, they're not gonna make it like me myself. I forgot what is. You understand? You get me? So they would know unless they mention the normal next to it. In PLAB 2 guys, they're not gonna give you something without normal values. Any blood, anything, you don't need to. If they give you something and it is abnormal, they will tell you in brackets
It's a normal.
normal, because they're not expecting you to go to to go to an exam, and
They're not testing that.
they are not testing. Does he memory? No. That's why when they give you medication, they leave the PMF. Use it, brother. So
In that case, can I suspect osteoporosis?
Yes, yeah. So, how would you start the station? Okay, in history, do you want differentials? Or do you want causes for osteoporosis? Causes. I hope that by now you understand the structure. Like, you don't want plenty of questions. However, the causes of osteoporosis are full history, which means plenty. Because osteoporosis, you need data, you need family history, you need medication history. You understand? So, what are the questions that I will have in this station? What are the questions? First of all, is the type of injury. How did you fall? Why? Yeah, because osteoporosis, the bone is weak, the fracture easy. Yes, but I'm saying, guys, you explore not much, but in the type of how it happened.
This is like rapport.
Yes.
Included in the part of
yes, that's what I said. It's a rapport, and at the same time you're trying to establish the mechanism of injury.
Okay.
Then head toward the causes. The causes could be what?
Medication.
According to the structure, up to down. Medication is المفتوزة, eh? Could be DESA. Very important. Yes. What else?
DESA, medication, medical condition.
Medication. What medications? Steroids. What else? Hormone replacement therapy?
No.
That's
POF هي اللي
yes, that's what I'm asking you. Hormone replacement therapy? No, it is the opposite.
The opposite.
What medication? COCP? Well, the reason why I'm merging this with the premature ovarian failure, because you get mixed up. Whenever you put them in the mock or difficult stage, and you mix things up. That's why I'm focusing into things that you filter, yeah? Now, family history?
Yes.
100% family history. Surgery. Surgical history? Yes. Hysterectomy. Yeah. Okay? And that's it. Anything else? No. So as simple as mechanism of injury. Quick. Nothing quick. As a part of rapport, and you need to know the revenge. As simple as DESA. As simple as medication counseling. What medication are you on? It will be steroid side effect. Family history. Okay? Now, explain the results. Explain what's happening in the station. Explain that there is something called DEXA scan. We have done it. It shows that you have such a condition. And explain the osteoporosis. What is osteoporosis?
Weakness of the bone.
I need simple, yani. Don't worry. Don't be. You are not showing the examiner.
Weak fragile bone.
Yes, that's it. Okay. Is diet important in this case?
Yes.
Important, yeah.
Yep.
Okay. Is exercise important?
Yes.
Why?
Because it increases
It includes exercise what?
build the bone.
No, because I want to make sure that she's not doing the wrong exercise. Some exercise, yeah?
Put the strength in the muscle
Strengthen
around
the muscles, which should
Guys, but some exercise she cannot do them.
She's 65.
That's what, guys,
she will need
that
an
they do
expert.
exercise, he is 65 and they run. Wallah al-Azim. 65 years old, they do exercise and they run, yeah?
Vigorous.
I had a male 55 years old. 55. That's real life, yeah? Like about a week ago. Fractured femur. And I was taking history. And they fractured it because I was running in the marathon. 25 miles. It's like from here to Manchester.
25 miles?
Yeah, marathon, yeah. And I fractured my leg. My leg gave way at 23 miles. Wallahi. That was the history. Wallahi. Brother, I told him, I go to the second floor and I feel short to his breath. I'm 35. I seriously told him, I go to the second floor and I feel short 25 miles. So yes, 65 years old, don't worry. She has sex. She asks you about, if you tell her about surgery, when can I have sex? Don't worry. 65 years is not like 65 back home, yeah? So don't be sure. Because when I said exercise, 65, yeah. Back home, hold my hand يا ابني. هنا in UK no. بيقولوا كده شدني يعني. When they said they cannot stand. Yeah, but here lifestyle is different. 6 years old male, you see him slam and yeah. So, management, arms, advice, risk factor, which will be, please, diet, exercise, smoking and alcohol. Advice. Exactly like which case that I said mainly advice? Yeah, I've just said PCOS. Advice, that's it. Advice. Do not think of we'll do no advice. So listen. MMS. This patient, she will need medications like what? Bisphosphonate. And when you mention bisphosphonate, always tell her standing or sitting, plenty of water. Are you following me? Okay? What else can she take? Vitamins, calcium, vitamin D, and that's it, medication. Multidisciplinary team? Dietitian? Physio? Physio that will tell you about the type of, because not all the exercise you can do, okay? Occupational? Yes, for the house to be safe, so she doesn't have falls and fracture. Next station.
The medication and the
analgesic.
HRT والهرمونز والميديكيشن هنا given by the GP ولا given by the specialist?
GP. Yeah, GP. GP here does things, yeah.
Yes.
Alendronate, yes. Bisphosphonate, yes.
So we are going to talk to the senior and give her alendronate.
Always senior, always, yeah. Always senior, yeah. Yes. Next station, very important. Analgesic nephropathy. Okay, in a village way, it's a station.
Comes medicine,
That both. Yeah. It's a station when they are giving you deranged kidney function. Deranged kidney function. And when you take history, the only positive is what?
Back pain.
The only positive that she or he is having back pain and they take NSAID. Clear? They take?
Non-steroidal.
That's it. Clear. At the door. Kidney function deranged. And when you take history, you will find she has back pain and she takes NSAID. Non-steroidal antifungal, okay? How would you start the station? The question is, you are an F1 doctor, GP clinic, 29 years old, came because he is having hematuria, complain. Blood test done, high creatinine, low GFR. Okay? So the blood test is showing you there is kidney problem, but is there a cause here? No, there is no cause yet. There is hematuria, right? That's it. This is the case. Hematuria, but kidney function are abnormal. So, what brought you for this test from the first place? He will say to you, doctor, blood in urine. Blood in? Simple. Track? You know what track is. Timing, relation, amount, color. And when I see color, I mean there is blood there, but is it at the start of urination, blood then urine, or throughout, or at the end? Why? At the start, it's at the tip of the penis, like at the start. Throughout, urethra. Or bladder from the back. So urine, then blood. Clear? Then, any bleeding anywhere else, because it's the bleeding structure. Track, bleeding anywhere else, blood thinner, bleeding disorder, questions. That's it. Then, that's for the hematuria. Then, when you take history, you will say, doctor, any medical condition? No, doctor, but I have some back pain for which I take NSAID. Ask about what medication, what type of NSAID, and since when, how long have you been using it? Is it over the counter or prescribed by? He will tell you, doctor, I've been taking it for a few years, not prescribed by the doctor. Clear. This is the positive finding. Now, don't forget that what can be the cause of blood in urine? Cancer?
Stones.
But before cancer, I'll ask about trauma. Stones. Infection. So have you hurt yourself? Any procedure? What's that? Trauma. And then? Any fever? Do you feel unwell? Infection. Any weight loss?
Flows.
Done. History is done.
I
Clear?
need to ask about puffiness in the face and edema, any other place like shortness of
If you
breath.
mentioned.
The kidney
But now he's coming with blood in.
And sometimes he comes for a well-managed checkup and then the stations come.
He's asking about the puffiness in the eye, swelling in the feet, which is kidney problem.
Kidney failure.
Yeah, so that's what I'm saying.
Acute kidney failure.
So this is a different case. Now,
I know this is the test result.
now, I always tell you don't be scripted, yeah? But before the exam, that's, oh, seriously, that's my way. Be scripted, okay? For about 6 months, everything. A month in the academy or 6 weeks, we only discuss what is as it is. Because I know you're not scripted at all. I know you just like, okay? It's another station. You see? So, it is the station of the patient who's coming with EGFR. A week later, EGFR and genetic history was diagnosed high blood pressure, taking medication, something else. It is failure here, coming in the stage. But this is no, okay? So, and the EGFR is there is about, it's given in the question about
20 or 30 something.
yeah, 20, yeah, something like so.
Urea level is high and
Yes, different stations, okay? Anyway, so in this station, what is the management?
Stop that aside. Stop that
Perfect, that's what I wanted to hear. Advise the risk factor. Arms. What is the risk factor?
The medication.
Medication. Stop the medication. It is the cause. Okay, so always start with the cause. Okay, what else you wanna say to this patient?
Refer to the pain management team.
Okay, what else?
nephrologist.
Nephrologist, what else? Specialist, what else? Anything about the diet, the fluids, the
Don't
Huh?
take fluids restriction of fluids.
sorry?
Fluid restriction.
Yes, fluid restriction here. You don't want any load in the kidney at this time. That's what I wanted because of
Admitted?
sorry?
To be admitted?
No. You refer to his GP clinic.
Okay.
It's all I said from the start.
Yes,
All
yes,
GP.
yes.
Refer.
Refer now?
Nephrologist, not urgent. He will be referred.
How we restrict the fluids by advice only?
You will tell him to decrease the amount of fluid because in this case we need to restrict the fluid. I was waiting. What? I want to know plenty of fluid.
And the salt.
Yeah, and salt what? Decrease or increase? Decrease. Yeah. So no, it's the opposite of. They drink plenty. Stones drink plenty because this is now it's a problem. If you say to the patient coming with kidney and then you put load in the kidney, okay? So decrease, not increase, yeah. Sorry? No. Why?
Not medical.
No.
It's not a medical.
Yes, it's insane. It's like no, you don't need to open it.
And I wouldn't go exploring the back pain.
That?
I will not go through exploring more about the back pain in
No,
the presenting
no.
moment.
Back pain تخش بقى is it cancer, is it prolapse? And then when you go to prolapse, is it what is the cause? And then you manage the prolapse and you manage the blood in urine. No.
But in history, don't I ask about the back pain? Who did someone see it? Did you visit the doctor?
Well, that's why I said, and that's what I said. Is it prescribed by a doctor? Is it being taken over the counter? That's why.
So in management, do I refer to pain management because it's going to go back to his
You can, yes, you can. But this is not the core, but yes, you can. I mean, he's still in pain. Stop this. That's my main thing. The purpose of the session is the kidney. So, talk about the flow restriction and stuff. Refer to kidney specialist, and then you can say for that pain, I can refer you, Guys, 2 stations, because we are about to finish now. So the doctor can have the teaching. I know, by the way. It was either just teaching or this and then teaching. So I said, and I'm sure you benefited something.
Yeah, of course. Thank you.
I'm trying to give you. It's an important topic. I could have done it at home, like with the board, but I just wanted to share it with you. So it's a revision for you. Even if your exam is tomorrow, it is important. It's not. It is all important cases. So the next 2 cases, MRSA and the Clostridium difficile. Again, I will put them together. What do you mean by together? As a comparison while we discussing them, because I don't want to memorize, just like in a village way. These cases, Are they diagnosed?
Yes.
Yes, diagnosed. So, end of story. They are diagnosed. Dr. Sabrina, can I have that charger, please, if you don't mind? لا أنا في الباور بانك أنا لا the charger that you have you charge the phone on, please. MRSA and clostridium difficile. How many times have you seen them? Plenty. Yeah, but people do fail them. And I focused many times on the management and but we still make the mistakes. Do you wanna? Okay, what is the difference in a village way? When I say village way, I mean village way. Okay. The MRSA, the patient doesn't have any symptoms or anything. Really? Yeah, he's a carrier. Carrier, yes. And the swab is taken from? The nose. And sometimes they take the swab from? Axilla or from? In case they change a new station. عادي. عادي, it's fine. You understand? So, in case they change it. So the swab in this station will be written. A patient who is admitted, that's the scenario. A patient is admitted. So let me write them both down. So while I'm going through them, I'm sorry they are important. That's why I'm just trying to. And when we put them in the mock, we don't do them good. Okay? So C is Clostridium difficile and MRSA. Both of them, I will discuss first the MRSA. The question will say, yeah, a patient is admitted in the hospital for whatever condition, COPD, infection, anything apart from our topic. But the only concern that his wife is concerned, because when she visited him, she found that everybody is having apron and okay, everybody. And they isolated him. What's happening? That's her concern. So I'm telling you because she will ask you questions. I'm telling you, does he have any infection?
No.
It is just carrier. It is written in the question that they took a swab from his nose and it shows MRSA. But it can change. They took the swab from his groin. They took it from under his arm. It's all the same. Talk to her, address her concerns. Okay. This station, there is no infection. What is the management in this station? Guys, nothing about. They shower with some topical. They put some topical cream on the nose. Nothing. Yes. There is no. Do you give antibiotics? No antibiotics. In a village way, what about the Clostridium difficile? Yeah, a patient is admitted. He's having a chest infection. He's having what? We started him on antibiotics. No problem. But suddenly he developed what? Diarrhea. Okay? His wife again concerned, why you isolating him and this and that. And it shows the question is diagnosed. It shows they took stool what? Sample, and it shows Clostridium difficile. Okay, in this case, there is infection. How come? He has a chest infection. You mean a chest? No. He has a chest infection. We give him antibiotic. These antibiotics killed some other bacteria in his stomach, which caused the diarrhea. So, the management is what? Stop the one he's on and give him another. Clear. I will stop the antibiotic he's on and I will give him another antibiotic. Are you following me?
Yes.
Okay. So does he have an infection?
Yes.
He does. But don't forget.
The chest infection, not the cause of isolation.
Don't forget that he's having what?
Dehydration.
Make sure you give him medication for
diarrhea.
Be careful. So make sure you also give him medication to stop that.
No.
I'm talking to him. Yeah. So
انا سايبك وشهر اخرتها.
If she told you, doctor, would you give him something for the diarrhea?
No.
Diarrhea will stop by itself when you stop
No.
the medication.
Why, doctor?
Flushes out the toxin.
Yes, it flushes out the toxin. That's your answer. It will flush out the toxin. But we'll monitor him for something called dehydration. We'll make sure he's well hydrated. We can give him fluids. And
Yeah.
guys, did you understand him the village way? Let's go the.
Civilized.
Sorry? You sure? ما عشان الغلابة دول ما انتوا الفيج because you have the background of the long course. كلمتين كده تضحكوا عليهم بيهم. ماشي؟ Okay. You are an F1 doctor in the respiratory department. David Harrison. بص حتى الأسماء David Harrison. Was admitted 55 years old with COPD. Swab was taken from the nose and they came back positive. He's isolated. His wife is worried. Normal? I'm Dr. Fatah Al-Najjar, Dr. Zahir. Can you please confirm your full name and date?
Birth.
Why? You took him to his wife. You don't need date of birth. Unless you say to leave him and come with me, then date of birth. Okay? So then, can you confirm your husband's name and date of birth? Then start. I can see from my note that I want to speak to one of the doctors. You have some concerns. Start the station with concern. What concern you want? Well, doctor, I came and I saw him isolated by himself and everybody's this and that visiting him, have it, okay? Well, I can see you are very concerned. Yes, that's right. Doctor, did he develop infection from the hospital? Did he develop infection from the hospital? No. No. Okay? I can see you are concerned. However, how much do you know about Mr. Ali's condition or Mr. Harrison before we go? He had a chest infection. Yes, that's right. For that, we are treating him. But why did you isolate him? Well, we have taken a swab from his nose. Understand? A swab. Okay? That we found that there is something called which is, what's MRSA?
Kind of bacteria.
What is the... Yes, it's some sort of bacteria that usually is on our skin. We found it in the nose. However, as he is sick, as he's got the infection, as he's got the COPD, which is a condition that decreases the patient's immunity, we are worried in case of this bacteria goes to his blood stream. So usually also spread between patients themselves. That's why we isolate. So I isolate him for two things. For him and for other patients. Clear. Don't say to her, well, I isolate him because the other patient will be infected. But no.
Keep a close eye on him.
Keep a close eye on him to make sure that it doesn't spread to other patients and for him as well. To monitor him. Okay. How does this bacteria spread?
By air.
Yeah. How does it spread from a patient to a patient? Skin, direct contact with things. Okay, she'll ask you these questions. Okay, so what would you do with him, doctor?
In home?
What would you do?
Isolated. He will be isolated.
He's isolated now.
He will be treated.
We'll repeat that.
Swab.
Swab. We're gonna give him some
Antibiotics.
shower بقى. هنحميه ونسنجفه يعني. Antibiotic. قلنا no antibiotic.
Cream antibiotic.
Yes. And yeah, topical.
Topic.
Yes, I thought antibiotic بقى.
No, I'm talking about topic.
اوكي يا عم بهزر معاك كده.
لا ما الحاجات دي ميديكامنتال دلوقتي.
Okay, so yeah, so we'll give him body lotion and we'll give him topical antibacterial, and then we'll repeat the swab. Once it's negative, it's okay. Can his grandkids visit him?
No.
Less than 12 years old, no.
ايوه كده. Yes. Less than 12, no. Okay.
Really? أيوة حد ممكن يجي له.
But anybody who will visit him will be
taking
the same precautions. Clear? Do you want to ask Desa?
No.
How's his diet?
Really?
Does he do any form of exercise? I'm asking you. Does he do any form of exercise? Do you want to ask?
No.
No, it's not needed. The station is MRSA. This is the station. This is the core. Address her concerns, any questions she wants. Understand the question. As I told you, it's not an infection. It's topical. No antibiotics. The second case, similar. The same patient. Admitted for chest infection, COPD exacerbation. We given him antibiotics. So he's managed for chest. Suddenly, his wife visited him, isolated by himself, people going in and out. And it is written. They took a stool sample and they found it is it is written. So please don't go into DESA or diet. No. I can see from my note that you are concerned and you have some concerns. Yes. Why did you isolate him? Yes. I totally appreciate your concern. I can see you are caring why. But how much do you know? Assess knowledge. How much do you know? I know he came with a chest infection and he's an antibiotic. Yes, that's right. However, we found that Mr. Ali, whatever, developed what? Diarrhea. Has anybody told you? No, doctor. Is it from the hospital? Well, I can see where you come from. I totally appreciate your concern. It's not from the hospital. How do you know it's not from the hospital?
Because they did.
Because we did the stool sample. It shows constant difficile. Doctor, but how does, why do they have it? Yes, they do have it when patient on antibiotics. Sometimes this antibiotic kills some certain bacteria in our bugs, which give the chance to other harmful bacteria to grow and cause this infection. That's why it's having diarrhea. How would you manage it, doctor?
With another antibiotic.
Stop the antibiotic that he's on. That's it. Give him another antibiotic. If she asks you the name, she's not going to ask. Why? Because it's different from hospital. It's a guy vancomycin and metronidazole. She's not going to ask. She's not going to ask. Because of my hospital. When you move hospitals in the city, different antibiotic, different protocol. She's not going to ask. But you will stop this one and will change for the one.
The issue of confidentiality.
Sorry?
The issue of confidentiality.
The issue of confidentiality. If there is no consent, if you ask about a consent, in these cases, sometimes they bring it, any case can come as a confidentiality. Brother wants to know about his brother.
Wife about her husband.
Yeah, you must. It will be written. Consent is taken. That's something else. I've discussed it in another video, confidentiality. I even mentioned some examples of if someone is asking about relative, if a consent is mentioned, is taken, it's done. What if it's not mentioned? You can't ask.
You can ask.
Do you have a consent? Yeah, of course.
In this station,
If it's not mentioned, if it's not, of course. Ask Muran. Tell her she had this station. Ask her. She had it and she got 111. She got 3 out of 12. I got 9 people that day in the exam. They got all 2 and 1 out of 12. The passing score was 2 out of 12. Why? Because they brought it as confidentiality. And they said a brother wants to know about his brother. You should have asked, is there a consent there? If there is no, so a consent is a valid question to ask whenever a relative asks about his relative. Clear?
Only because this question...
Brother, if you breach your confidentiality, you fail. Oh my God.
We can take information from him.
You can ask. Yeah, you can take it, but you don't give. Yeah?
First thing I will answer, do you have consent?
That's it. Perfect. Okay? So, Dr. Reda, how does it spread? Yeah, contact. Okay? Contact to, sorry? Fecal-oral, the stool itself, yeah? Okay. Final station. Hypo. Dr. Reda. Habibi. Come. I bully them that way. Not nice. Dr. Reda. Hypothyroidism. You are an FY2 doctor in the GB clinic. Julia Robert, 34 years old, presented. And I know ان I took advantage. I took the pass. I know. والله لا أنا عارف. بس I was very upset that I was night shift and I haven't been to the academy for 5 days. بس يعني ساعات باجي على حبايبي بس خلاص أنا خلصت والله يعني.
It's according to them if they need to finish the teaching or we can postpone the.
They need.
No. It's the last class that we have.
But look. I promise you, I will stay here with you until you finish. يعني equality. خلاص؟ يعني I'm not gonna go and I've done and you. No, I'm gonna stay with you. Okay? I nearly finished. Give me maximum like 10 minutes and last station. Okay? No, 10 minutes. No, he's not gonna go. No, he's the king here. No, it's his day today. You are, what is the case called? Hypothyroidism, okay? You are an FY2 doctor in the GB clinic. Doctor, why I know you feel stressed.
No.
You sure?
Yeah.
Okay. Yeah, okay.
They know me.
No, I don't know. I like when I see doctors, like, you know, You are chilled all the time. Yeah.
ده انا اكتر حد ستريس
Really?
انت عكست.
I chilled.
انت عكست.
بقالك 4 ايام ما بتجيش.
You are an F5 doctor in the GP clinic. Julia Robert, 34 years old, presented a week ago with weight gain. What is the complaint?
Weight gain.
Blood tests were done. T4 is low. TSH is high. She came today for her result. Do you know what's happening?
Yes.
Yes.
Do you really know?
Yes.
Okay. So do you wanna take causes of weight gain?
No.
No. The structure. I can see from my note you are coming today for blood result. Yes, doctor. Glad that you're coming to see us today. Would you like us to have a chat or
Talk about the blood.
talk about the result? Doctor, chat. Okay, it's fine. First question. What brought you?
To do the test and the
Doctor,
studies.
I gained weight. How much? Do you weigh yourself? How much increase in the weight? Normal weight questions.
Okay.
Apart from this, any other
Any other complaint?
symptoms? Yes, doctor. She will give you tiredness, mood.
Period.
She will give you BMW. She will give you
The BMW.
B bowel, which is what? Constipation.
Constipation.
M,
Mood.
mood.
Low mood.
She's gonna be always like swinging, you know? Weight is weight gain and weather preference. You okay? Any concerns? Seriously. Okay. W, weight gain, and she will give you weather preference. That's it. Symptoms. Now I will move to causes and complication, which here is not much. What is the main things I want to ask about?
Family history.
Family history. Can it be a risk? Family? Yes. Do you want to ask about how old is she?
She's 35.
The question I said.
35.
34. Blindly. What do you want to ask about?
Before.
Blindly. No doubt. Don't even think about it. P4. Is it period important?
Yes.
Pregnancy. Guys, please. Whenever you have a female in this age, please, P4. Seriously. P4. All the time. These are the cases. Any female, P4. Okay? Now, I established the symptoms. I know the symptoms. Family history. I've asked about the P4 period and everything. Now, does thyroid affect period?
Yes.
Of course. Yeah. Now, move on to explaining that.
The result.
Guys, beautiful explanation. We have a gland in our neck. It's called the butterfly gland. Okay, what else? This gland, the job of the gland is responsible for secreting a hormone that is important for the body function. In your case, the hormones are
Low.
that means that your body is slowing down in function, which is leading to these causes, these symptoms. Have you realized by now how to explain the result when I say slow and take your time and don't run? Run through the history, but don't run through the
Explanation.
Yes. Guys, you are tired. You look, both of you really, you want to sleep.
Me?
Yeah. No. Seriously. Did you have enough sleep? Yeah, I can tell. Yeah, I can see. Yeah. We nearly finished. So explain the result, the T4, the TSH, thyroid hormones and everything. Then come to management. Simply. What is the management here? What is the management? Huh? Sorry?
Referral.
No. I will start
So first
in the
advice
GP.
is,
100%, yeah. I will start in the GP. What? Thyroxine. Do you want to talk about it? 2-3 words. كل عيش يعني. 2-3 words.
It's like
Medication will be given 1 tablet a day.
before breakfast 30 minutes.
Okay?
Before breakfast.
Before food. Alright? And this medication is important. It will keep the function of the body. But we will follow you up with some blood tests
Again.
to monitor the hormones.
Okay.
And you will refer her to
Gland
The
specialist.
gland specialist.
gland specialist. Am I making any sense?
yes.
So please, when you talk about thyroxine, when you talk about thyroxine, please,
Side
thyroxine,
effects.
iron, bisphosphonate, يعني
Side effects.
2-3 words. And I'm not asking you for all medications. Some medications we know them from Plab 2. The medication, when I say talk about this, that's a medication we talk about. Okay? Now, in these cases, always safety netting or give safety netting for the medication itself. So, she's gonna be given thyroxine.
If she develops diarrhea.
Can she develop hyper?
Yes.
So always, this medication will take some time to monitor the hormones in the blood until we get to the right dose. You can develop some side effect. It can be that your heart will be racing. It can be that you'll have sweating, which is the opposite for symptoms. You understand?
Yes.
Sorry?
Please don't stop the medication.
Yes, come right away. We're gonna adjust the dose. Okay, then you adjust the dose for her mother, and then the daughter is angry. You know the station? Angry daughter اللي thyroxine change. يعني بص بيشتغلونا.
Give me the phone number of your daughter to call the daughter from now.
Yes, والله it's like والله مش عارفين angry مش عارفين نرضي حد. We cannot satisfy anyone. This is really the last station, yeah? This one. Seriously, this one is the last. Seriously. I know you are angry. Huh? I can see you, Allah, in your face you are angry. Okay? But if I have a doubt that this is not more important than teaching,
I would have stopped.
I would not even tell you guys.
والله دكتور الأيام اللي فاتت counseling 4 station في الامتحان.
4, I no, seriously guys, seriously. If I have a doubt that this is not, I'm sure you follow the exam stations, and I'm sure you know how many stations today we have mentioned, and they are all challenging here. Okay, so, and at the same time, we are losing. Like, I'm upsetting him because he's gonna say now, look why he comes and I stay for 3 hours and then I will go home late. So it's for your own benefit. So we're doing all this disturbance for your own benefit. I'm not here to annoy you, but I know really what is important and what is less important, okay? Because I can see that she's really like, if she has, she will, I know. Anyway, last station, seriously. Parathyroidism. Okay. The same. I will read you the question. You are an FY2 doctor. Sandra, 30 years old, came a week ago. What happened? Blood test shows parathormone high. What is that? Parathormone high? Parathyroid hormone. Okay. Calcium high. Everything else is normal. So what is the two things that's parathormone? Clear? Okay. Leave this now. She's coming for the result. She's coming for? Leave this now. Is it a medicine station? I mean. Is it a blood result station, right?
Yes.
So the start is as we know.
Yes.
Okay. But please, because there is high calcium. There is?
High calcium.
So doctor, what do you want us to remember? What is the olive of the station? The olive of the station. Increase the calcium. Increase the calcium. Yes. Moans. Groans. Stones. Bones. Sitting on king's throne. That's it. Sorry? King's throne constipation.
Yes.
Yeah, he's sitting in king's throne, like on the king's throne, so he's constipated. Wallah, every time I see him, I get upset. Dr. Rada. Moans, she's moaning. Mood. Disturbance. Groans. What? Is in pain. Pain. Abdominal pain, yeah? Tummy pain. Stones. Always they have kidney stone calcium. So any pain, low into growing, when I say stones, you know that few questions. Any low into growing pain. Any problem passing urine. Any blood in urine. Clear, guys. That's all for the word stones. Bones. Any bone pain, bone ache, calcium problem. Sitting in king's throne, she's sitting or he's sitting on the king's throne, doesn't want to leave. On that toilet seat, constipated. These are the symptoms of what? So please, whenever you see the question, Okay, first of all, Mo told us it's a blood result. So very important to explain that. Result in the middle of the station. Okay, there is calcium high. So, moans, groans. So I will ask about these symptoms. Everywhere there's 3-4 questions. Do you agree with me? Yeah. Everywhere it's 3-4 questions. Okay. So because king's throne is constipation, any bowel habit problem, how is your bowel habit? You need to buy time. Okay. So I will ask these questions. The plus one thing. Yes, perfect. Any hypercalcemia, first differential cancer.
Cancer lung.
Yeah, any hypercalcemia. So always ask flows. And I'm happy.
Even if not so old.
Sorry?
Even if the age not so big.
Of course.
Sometimes occupational.
Of course,
like
cancer
mesothelioma
guys
can
can
bring
come
a
to
cancer.
guys. Yes, cancer common old age can come to any age. Yeah. Guys, that's my main concern. What do I mean by my main concern? And I don't forget. By the way, when you have a map in your head, if you have fixed questions, trust me, you don't get lost. You know what is the difficult part in any OSCE, any station? The start. You know, once you start, which by that I mean once you know the first 2 minutes. If you roll the first 2 minutes, wallahi, it will flow. But if you can't start, if you don't have fixed things to start the station, then it will be tough. Do you understand what I'm saying? After, I mean, the first station is more difficult than the second one in the exam. Once the first one, is that normal simulator? Everything is, so things becomes
smooth.
And at any station, if the first minute or the first 2 minutes you are talking nicely, it will flow. That's my point. So now, 5, you must ask, plus flows cancer, weight loss and everything, okay? Now, do you want to ask about medications? Medication, are you on any medication? Including over the counter? Yes. The case is hypercalcemia. Can it be his on calcium supplement? Yes, so OTC drugs, over the counter, supplement. Okay? And you should ask about other medication like thiazide. It causes disturbance in the urine and the calcium and the potassium. Thiazide. Okay? So 2 things on medication. What are they? Thiazide and
Calcium supplement.
over the counter. Cancer is differential. The 5 questions for calcium. Okay. Would you like to examine? No. You're not gonna test result. So after the history, what is the middle part? Explaining gas parathormone. It's a gland in the neck, you know, secretes calcium. It's increased. Secretion is increased. Calcium level is increased. Calcium is mandatory for our bones. Simple, please. Take your time. Explain. Management.
Could ask about
Sorry?
Could ask about surgery. Could be risk.
100%. Very good. He's talking about surgery.
Surgery, removal of the thyroid.
Tell me, because it's very important to come in MRCS question now. Have you done MRCS? No. That's coming now. Removal of parathyroid gland. What will it lead to? Which another way? He said surgery. Yeah. Removal of thyroid can lead to parathyroid. What will happen if you remove the parathyroid?
No parathyroid.
Will it be hyper or hypo?
Hypo.
Hyper or hypo? Hypo. At first hyper. As a reaction for the body. Then we'll carry on. Hypo. He's talking about this period. If that's what you, because that's like straight MRCS. So at first hyper, then they will be at first hyper for the body reaction, and then it will be hypo. Okay, so ask about surgery, but be careful because it's not gonna be long-term hyper. It's just gonna be hyper. Then clear, guys. Ask about surgery. It's fine.
Okay, so we are not assessed on examination or for examination
No.
but in teaching station.
No, you're gonna refer him. This guy.
No, but you mentioned 16 stations. We need to mention about the examination.
Well, now I said no.
Yeah.
You understand me?
Yeah.
Now I said no, don't.
I am the one who
Which
said and
stations
then
we shouldn't examine?
Okay. The station that is counseling,
yeah.
don't. Clear?
Any counseling.
Any counseling, don't. Clear?
Only in the history part.
Any medication counseling, don't. Any blood result, don't.
Don't examine.
Sorry?
Don't examine.
No. Don't even verbalize.
No investigation also.
لا بقى
sometimes there is.
ARMMS لا احنا بقى did I say no investigations? No, I said ARMS. A advice, R risk factor, M is medication and
investigation.
M is multidisciplinary team, S is safety netting. Okay?
So if the case was diagnosed?
Guys, if the case is diagnosed, no differential.
No examination.
No examination, no.
No examination.
Why? Because it's a counseling. The patient is coming to you, doctor, I'm diabetic, but I had dizziness a week ago.
Okay, this will not.
Hypoglycemia, complication of?
Diabetes.
What would you examine?
At least the observation to make sure
he's fine now. That's what I said. I had something sweet and I'm fine
No,
now.
because we saw the long course. You keep saying. That's
No,
why-
guys, I know.
He is the one who says no
Listen,
now.
listen. I know what I said in the long course. I know. But there is something called we modify ourselves, right?
Yeah.
And that's me as well. I mean, there are little things, that little tweaks, yeah? That if you don't modify yourself, you are not a good person, yeah? So, 2 years ago, 2019, but by the way, don't worry, there is nothing that... No. It's little. Like these stations that I've mentioned now, copy and paste from what I say, but I taught you an extra thing, go down in history. Don't go too much in data. Don't go. So it's tweaks, but I mean, I think improving yourself is, it's something. Huh?
So the fourth.
Yeah. Like I did in 2019. I was teaching PLAB from my experience, my background of an academy I took and PLAB and things I did. Then I worked for the NHS. Then my experience became 2 years, for example. Then I started doing OSCE examination for Liverpool University. So they taught me how to assess students. So if that doesn't reflect on my work, that means I'm stupid. No, seriously.
Yeah.
So that's one of the things, I mean, relevant history, guys, in these stations. You understand? But don't worry, you are fine. By the way,
Where
the scores people getting these days, wallahi, it is extremely like 154, 155. Extremely high scores these days. Extremely high scores. From the old course. Beautiful. I love it.
Yeah.
So that there is no too much deviation from what we mentioned, yeah? Okay? Anyway. So guys, let's finish this. So he comes and then I'm gonna go in the room. You can come. Welcome. So seriously. So guys, so we don't get lost. In this station, hypercalcemia. Mons, groans, stones, bones, ask. Plus to exclude cancer. Plus family history. Yeah?
Yes.
Okay, medication, two things. It could be over the counter or thiazide. Clear.
Yes.
In management, arms. But before the management, you explain that. So, arms. Advised risk factor. About what? The risk. The risk which is if he's using OTC, if he's taking, supplement, thiazide review. Okay? Now, this patient, do you want to give him fluid or stop fluid? Give fluid. Okay? So, fluid. What about diet?
Decreasing calcium.
Cut anything that contains
Calcium.
decrease. Because the reason is calcium. Would you like to give any medication?
He has to take beside of
Yeah, what medication would you give? Or what things would you do to him?
Going to fluids work first.
Would you like to give him vitamin D? Okay. What is the relationship between vitamin D and calcium?
Vitamin D brings
Vitamin D
calcium into the blood.
increases the absorption of
Calcium.
So with less vitamin D, if there is a problem with vitamin D, it affects that. Even though you take calcium, it doesn't get
absorbed.
So that's the relationship. Again, vitamin D increases the absorption of. So if a patient is coming to you with calcium level low,
You give
opposite.
vitamin D.
You give him vitamin D and calcium. Because if you give him only
Calcium
calcium,
will be absorbed.
it's not going to be absorbed. So in the hypothyroidism, parathyroidism, if the calcium is low, you want to give both. But here, no relation. Clear. Because he will ask you, would you give me vitamin, doctor?
No.
What? No. You understand me? But what if the calcium is low?
Yes.
Give him both.
Because it will increase the absorption. This patient needs referral or not? Where? Gland specialist. Anything else you want to do to him?
Gland specialist give
Painkiller.
him medication, son.
Painkiller.
Gland specialist give him medication.
Yeah, we'll manage everything, guys. Even thyroid, guys. You know the thyroid? Hyper. Yes, we manage the symptoms. But what is the cause? That's why we refer, because you can have hyperthyroidism. You give him medication carbimazole.
Give him carbimazole in the GP.
But the cause is, but the cause is cancer.
Yeah.
You understand me?
Yes.
Can I give, if he asks for laxatives here, constipation?
You give symptomatic treatment. In this case, you can give symptom painkiller. Yeah.
I should make sure not calcium-based laxatives, huh?
بص ده كده بقى ايه seriously كده هو he needs to come in a station and you tell him 20 years old and he doesn't ask before then he will go back to his brain okay يعني بص calcium contains laxative brains على فكرة